Make a copy then, because
Okay, 6 o'clock, I'd like to call the Monday, July 26th Grafton School District Board of Education meeting to order. Ask everyone present to please rise for the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We've got a few things on the consent agenda item this evening. Approval of the minutes from the June 28th, 2021 board meeting and statement of receipts and expenditures for June 2021. Do I have a motion to approve the consent agenda items?
so moved. Second.
Motion made and seconded. Is there any discussion? Hearing none, all those in favor of the motion, aye? Aye. Opposed? And it passes. Jeff, on to you for the superintendent's report.
Yes, so back in March, I think we recognized Kevin Arneson and Thomas Frederickson for winning the Atom competition. Oh, that's okay. For winning the Atom competition, and now Thomas has moved on. He moved on just right before we had our last board meeting. He was recognized as a bronze medalist in automotive skills at the Skills USA National Leadership and Skills Conference. It was a completely virtual competition, but it involved hands-on work done here at high school in the auto bays. So congratulations so that you can see they did a Thomas Frederickson, the maintenance light repair demonstration. So he earned a bronze in that. And the next picture will show you Thomas and Kevin. Thomas is on the right-hand side. Kevin's the taller one. And then Mr. Fullington, who's our autos teacher, who led them to that state championship, also worked with Thomas to help him be successful. And then also our IT department helped set all the virtual pieces up. And then Greg's Hobb Honda Thomas has a job at Greg's Hop Honda, and they let him go back and forth to be able to compete during that time. So a lot of people to be thankful for, but congratulations to Thomas for third in the nation, which is an amazing feat for him. And then we were surprised with a visit by Governor Evers. We got a call on Monday, July 12th, asking if we would like to have Governor Evers come to our Summer Learning Academy. So he visited some of our classes. We had some of our students in one of our robotics classes, and they had programmed over that day, and right away that morning, as soon as they got in there, they programmed a hello to Governor Evers. So it said that to him, and so then he walked around, saw a couple of our different classes, worked with some of our students, had opportunities to take some pictures with some of them, so some of our teachers got to see him. And it took some questions from them about the pandemic and what it was like in Madison versus what it was like in Grafton. And so I was able to talk to them about that. Kids were able to ask him questions. There I am. I was able to talk to him as well. And then the final piece that we were there, one of our fifth graders, Leo Galens, had asked him, Governor Evers, can I take a selfie with you? And he reached into his backpack, got his cell phone out, and so I took my cell phone out. I'm gonna get a picture of you taking a selfie. But great, Leo. A lot of our kids just really showing, asking good questions, working with him. One of our students walking down the hallway stuck out his hand to shake his hand, and it was just really cool to see them interact with the governor, and great for him to see our facilities. Spoke very highly. One of the comments he'd made was make sure you tell your buildings and grounds person how clean this place looks, and he'd asked how new was it. So we talked about the referendum and the addition that we'd had and so forth, and so just spoke very highly of our students, the work they're doing, and it was great for him to see our district. So we want to make our community aware that Governor Evers was here. And then also I have asked Mr. Moore to come and give a final congratulations to our spring athletes for their all-conference for both sports and for academics.
Hi, good evening. If you remember correctly, last month we didn't have all of our all-conference and all-state recognition for our student athletes because of the WI season running a little bit over this year for obvious reasons. So we just wanted to recognize and take a moment to recognize those who achieved such things. Hunter Schmidt on the baseball side was named second team all-conference. He was actually also named academic all-state by the Wisconsin Baseball Coaches Association. The prerequisites for that honor was any player that earned first or second team all-conference recognition and had a GPA of 4.0 or higher. So a tremendous academic honor and athletic honor for Hunter. Colin Intermule and Nathan Wolf both earned honorable mention all-conference for baseball. For golf, if you remember Tyler Choi and Daniel Schmitz, we highlighted their all-conference recognition. We wanted to add that Tyler, Noah Scott, and Max Belkey also earned academic all-state through the Wisconsin Golf Coaches Association, which their qualifications were a cumulative GPA of 3.25 or higher and at least 75% participation in matches this year. Other all-conference recognition included for girls soccer, Isabella Rapp earned honorable mention all North Shore, and in softball, Sarah Paschke earned second team all-conference for North Shore Conference softball. And that concludes our all-conference recognition. Thank you.
Thank you, Mr. Moore. And then just a couple events that are going to be occurring before our next board meeting. We have online district registration, which will open on August 3rd. Then we have in-person registration and school photos. So that's one of the pieces that we've kept from COVID that was a requirement that we had trying to figure out how can we do school photos. With not having in-person registration, we did that. You signed up on a schedule and got your time for your photo. That's something that we are keeping. So that will be occurring on the 9th and 10th of August. And then we'll welcome our new teachers on August 18th and 19th, with all staff returning on the 24th of August for our welcome back, getting ready for September 1st and the first day of school across the board. So a lot of exciting things occurring before we have our next board meeting and making the board aware of those events.
Thank you. Any questions for Jeff? Of course, on behalf of the board, congratulations to our student athletes as we round out the spring and summer seasons here, and appreciate their representation of the district. So let's go on to the 2021-22 school year plan. At the May meeting, the administration presented an overview of some of the planning priorities for the 2021-22 school year and the initiatives that we might undertake at that point in time, seeking some input and some direction relative to whether they're on track or not on track from the board. That was provided at that meeting. They have since continued in their work. They're prepared tonight to present the 2021-2022 school year plan. for purposes of our consideration. A little bit different than normal, after the presentation of the plan, there will be an opportunity for public comment, or before? After, there will be an opportunity for public comment. That will be a separate public comment in addition to the public comment item C on the agenda. The primary reason for that is to satisfy an eligibility requirement for ESSER 3 funds that require public input for our reopening plans. Ironically, our plans are not reopening plans, as we were open the entirety of all last school year. Not every district can say that. Because of our careful planning and strong execution to those plans, we're able to stay safe, to stay open. So in order to honor that element of that requirement for ESSER 3, we'll take public comments after the presentation of the plan, and then perhaps consider possible action by the board. So I'll turn it over to you, Jeff, for the presentation of the 2021-22 plan.
Yes, so our planning priorities remain the same that we used last year. We used the same pillars. We said health and safety, quality instruction, efficient and safe operations, flexibility and responsiveness. We are following a similar process that we followed last summer. I think last year we also brought ideas to the board at the May board meeting, received feedback from the board. This year we did the same thing. Then in June we met with leadership teams individually at the elementary and at the secondary level, so teacher leadership teams, support staff leadership teams, getting feedback to us in order to be able to bring some recommendations to the board in advance of student registration, which is upcoming, which I just mentioned in all of those pieces. So those are the pieces there. We can see that we have the COVID-19 risk status. You've seen this every month last year, school year. We continue to follow the Washington-Ozaukee County Health Department. You can see the burden is, as of today, is at the moderate level for both Ozaukee and Washington. COVID-19 vaccination status, so among residents that are 18 plus, 70% of Ozaukee County residents have 1 dose, 67% have completed the series, 70% is the data point that has been shared multiple times, saying that so you need to get over 70% to be at that herd immunity piece. So in Ozaukee County, we have that 70% of 18 plus. Among residents ages 12 through 17, you have 50% that have 1 dose and 45% have completed the series. And there is no vaccine at this time for children under the age of 12. There's discussion of that coming out in winter, possibly early 2022, but no definite timeline yet on that. So as of right now, anyone that's eligible, it's 58.9% of Ozaukee County population has received at least 1 dose and have some type of antibodies in them. As a recall, we moved into summer school. So at that May board meeting, we talked about moving into our summer school and having face mask optional. So we moved into face mask optional for students and staff. We had a total number of 844 students, which is almost exactly the same number that we had 2 years ago in summer school. One of our concerns of moving to face mask optional would be, would we lose staff members? We had one teacher who chose not to teach because of that. We had someone else who came in to replace them. So we had approximately the same number of staff that we would have had previously. So we had 83 staff members that were involved in summer school. We are entering Section C today. Weightlifting had started earlier and went last week when we didn't have it, so they've already completed their 6 weeks. So a certain group of students have gone through 6 weeks of summer school. Certain students are now starting their 5th week of summer school. But out of all of those individuals that we had in our buildings that were face coverings optional, we had 0 COVID cases. As you look back to last year, as a recall of last year, we had the number of students who had COVID throughout the year. So we had our district dashboard that we looked at. It was updated daily. We would report out on that on a monthly basis to the school board. So you can see that for the last year, we had 8% of all students, highest percent being at the high school with 12%, the lowest percent at the elementary school with 5%. 15% of all staff had COVID throughout the year. You can see the number of close contact quarantines throughout the year. When we researched the quarantines, we discussed with the board, we did not have a positive case of COVID during that quarantine period from the close contact pieces that we had. So administration has reviewed guidance. We received feedback from the school board. We looked at DPI, CDC, American Academy of Pediatrics, DHS, Washington-Ozaukee Health Department, which I have up here now, to formulate our recommendations tonight. we do realize that there are different recommendations coming from different organizations. So American Academy of Pediatrics came out a couple weeks ago or a week ago now saying that everyone should wear masks even if vaccinated. CDC has said only non-vaccinated individuals should wear a mask. Department of Health Services in Wisconsin was asked, why is there differing guidance? And the response from the Deputy Secretary for the Department of Health Services, Julie Willems Van Dyke, had said, it's looking at a combination of how prevalent is disease in your community, how high are vaccination rates, and then what are the different levels of protection that we need to provide to our students. So you have national organizations making national recommendations. Just as we did last year, we looked at the guidance that those organizations have provided and reviewed those state and federal and local guidelines, but then have made recommendations to the board, and we'll be doing that again tonight based on what we believe is in the best interest of our students and based on the factors that we have in our community. So you can see that Washington-Ozark County Health Department guidance gave mitigation strategies to decrease the risk of transmission, and they have provided 8 of those strategies. The ones in bold are the ones that we are recommending that we move forward with. So it's promoting vaccination, the benefits of that, the ventilation systems that we'll talk about later, hand washing and respiratory etiquette, contact tracing in combination with isolation of positive cases, and cleaning and maintaining healthy facilities. We are not recommending consistent and correct use of masks for everyone. Physical distancing maximized to the greatest extent possible. We are recommending that we go back to that 2 to 3 feet that we've been previously prior to COVID. And screening testing, we did not attempt to become a testing site. There's enough testing sites in our area through the health department or through other agencies to be able to get testing very quickly now. That has changed. Health department also gave some recommendations of how to look at using various mitigation factors and how many strategies you should be utilizing. So at the top is total new cases per 100,000. So they have the low, the moderate, the substantial, and the high, or percent fully vaccinated based on the greater than 70%, 70 to 60, all the way down to less than 50%, and the number of factors that they would recommend that would go with that. At this time, we are in the moderate. We were in low last week. We were in moderate at this point. So you would have 4 strategies. We have 5 strategies that we're looking at. With us being close to that 60% already with vaccination status, we should be moving into that percent fully vaccinated and continue to move up on that bottom chart. So the rationale that we've used for our recommendations that I'll share briefly in the next number of slides, we looked at the community spread in Ozaukee County, the high percentage of vaccinated staff that we currently have, the vaccinations that are available for students ages 12 and up. Anyone that is 12 and up has had. If you don't have the vaccination, that's because you've chosen not to get that. There was a limited spread of COVID in school during the 2021 school year. We had no COVID cases in summer school, did not require masking. We had some students who chose to wear masks during summer school, but there was no required masking, and we had limited social distancing as well. So one of the things that we looked at and had lengthy discussions about is face coverings. We had a lot of discussion about this last year. We continue to have discussions about it this year. The recommendation the administration is recommending is that face coverings are optional indoors and outdoors for students, staff, and visitors. Federal law at this time does require that face coverings are on buses. So anyone that would be on a bus, whether that's on a right-way bus, whether that's on a field trip, whether that's on an athletic trip, whatever it would be, if you're on a bus, then that would be required. You'll see this disclaimer at the bottom of a couple different slides that just as we did last year, we're presenting recommendations that we anticipate need to be fluid. We need to be responsive. And so although this is a recommendation right now, obviously if there is abrupt or sustained increases in COVID infections in the community and or in our schools, we would look at modifying those practices just as we did last school year to keep us open. Contact tracing, the biggest difference here will be that we will not mandatory quarantine someone for being in close contact. Now what we would do is we would notify a student, we would notify parents if a student in a classroom has been diagnosed with COVID. Families can then determine if they will practice self-quarantining. So we will not be looking at 6 feet or 3 feet. At this point, we will be saying in that classroom setting, these are the people that have been in that classroom and letting parents know of that those that are affected in that way. Students who are self-quarantined, so if a family chooses to self-quarantine, they have been provided a link to classroom videos within 24 hours of request. This access will be view only. I'll go more in depth with view only, but you'll hear that a couple different times. So unlike last year where we had virtual learning that was synchronous, so students were logging in, teachers were having communication with students in class and the students that are virtual. In this case, if someone were to self-quarantine, they would have a view only, so they would be, the camera would only be on the teacher, it would not be on the class, it would only be on the teacher. They'd be able to hear the teacher speak. At the 6-12 level, they'd be able to utilize Canvas. At the elementary level, they'd be using whether it's Seesaw or handouts that would have to be used, sent home for that, but it would be view only because of the strain that it put on our teachers doing the synchronous learning, in all honesty, and this being a quick turnaround time if you had to quarantine someone. For quarantining, students who test positive for COVID, we would still follow health department guidelines for quarantine. So it's 7-day quarantine with a negative test or full 10-day quarantine without a test. We would, like we did this year, we would use Skyward to label or to code them correctly in Skyward so that classroom teacher would know and would be able to send assignments home and so forth. The office would know when the student should be able to return. And then students who are quarantined due to a positive COVID test would also be provided that view-only link, so they would be able to at least hear the direct instruction that's occurring or the classroom discussion that's occurring and be able to stay up to speed with what's going on in that classroom. We would recommend that we would maintain our enhanced symptom monitoring. So we would be strongly recommending, again, as we did this year, that anyone with viral symptoms should stay home. We've talked about that before. We used to have perfect attendance. We've done away with perfect attendance, whether it's for staff or students. So anyone that has symptoms should stay home and are encouraged to get tested before returning to school if symptomatic. Students and staff should be symptom-free, unmedicated for a minimum of 24 hours before returning to school. And then students presenting with viral symptoms will be asked to wear a face covering and be isolated until they can be picked up or are able to leave school. So similar to what we had this year, they're wearing a face covering already. In this case, they would be asked to have a face covering on and isolated until they can either parents come or if they're old enough to drive themselves, whatever the parent would release. We would continue our district dashboard. So to monitor COVID cases by building, that would help us to make sure that the practices that we are following are working and we are keeping our students and staff safe. We would continue to update it daily with new cases if they occur. It'd be posted to the school website just as it is this year for students or for families in the community to view the number of cases that we have. So a big change would be virtual learning. So last year we started off by saying, with all the unknowns that we had last July, there not being a vaccine at all, we talked about virtual learning for anyone. So we had some families that started with virtual learning, then came into in-person. We had some that started in-person and went virtual. Then we had some that would go virtual right before they had a culminating event, whether it's cross-country, state, playoffs, musical, whatever it may be at various levels. This year, the virtual learning option would only be provided for students who submit a homebound application and have a medical excuse from a physician. They would also be saying they were going to submit for an entire year. This was a discussion that we had with staff. We do not see ourselves as being a virtual learning institution. We see ourselves as being an in-person learning institution. However, knowing that there are still concerns with either the ability to not receive a vaccine or even other people that may be high risk not being able to receive the vaccine and having concerns at home, there may be those who still do need another virtual learning option for one more year. So this would be a one-year window. We talked with staff about this because it wouldn't be optional. It wouldn't be an opt-in, opt-out, changing back and forth, because that's where it was the hardest for teachers, would be to know how many kids are going to be virtual versus my in-person, what's it going to be like tomorrow, what's it going to be like a week from now, all those pieces. So at the elementary level, if there was a first grader, if there was multiple first graders, we would group them into one classroom teacher and balance classrooms out. It wouldn't matter if the student was a Kennedy first grader or a Woodview first grader, they would be assigned a teacher. And because that teacher would be doing more, we would be looking to have a stipend for that teacher because they are going to be doing more. This year, everyone did more. In this model that we're recommending, it would only be those that would have virtual students for the year that would be doing more work. So similar to other things, extracurriculars that we have that we offer a stipend, we would be offering a stipend to those staff who would be working extra for those virtual students. This would be exactly like last year. It would be synchronous. There'd be live interaction with teachers, students in the physical classroom. They would pair them up, and if they do small group work, the teacher would pair up the virtual student with in-person students or the virtual students that are virtual together, a mixture as it goes through. but this would be only for students who have that application that gets reviewed by district office to get approved. One piece of that is that medical excuse from a physician, and it is for the entire year, so it's a commitment from the parents. Because it is a concern that you're saying, we don't want my child to be in person, then this person would not be eligible for in-person extracurricular activities. This past year, they were able to be. We had some students who, for various reasons, were virtual, but then were in person for whether it was a culminating class at the high school, or maybe it was an extracurricular activity at the various levels. This would not be we would recommend that virtual students are not eligible for in-person extracurricular activities. And there may be some courses that they might not have access to. We attempted to offer all courses as a virtual option this year. Some were very successful, some with limited success, and some courses are very difficult to have it be a virtual option that is consistent with the expectations that maybe students, parents, and our staff have at the various levels, especially at the secondary level. So I talked a little about this view-only classroom access. So we talked about temporary virtual learning. So I know one of the discussions that the board had back at the May meeting was saying, you know, we have these cameras, can we utilize them for students who may want to be able to see a view only, to be able to check in and not miss out on the direct instruction, or at least I'm hearing the teacher talk and I can connect with a friend of mine later on what was going on in some of those pieces that maybe they're doing now. So some of those view-only classroom accesses that we're recommending would be quarantine due to a positive COVID test. I referenced that earlier. Also a non-COVID illness of more than 3 days. So in the past, if someone has come down with the flu, and then if you're sick, then you shouldn't be doing homework when you're sick. You should be getting well. So, but if you're gone more than 3 days, then you're falling behind. So then that would be a situation where we're saying, yeah, we should get you if you're interested in getting a link, then we will provide that for you so you can see what's happening in the classroom. And then when you're coming back to school, whether it's in SOAR or ROAR or whatever it may be, or BHT, you can be connecting with that teacher to be able to get caught up. But it would be a non-COVID illness. If there's a extended medical absence, so someone's having surgery, or they have, strep throat or mono or something like that, they'd be out an extended period of time, we'd be able to immediately provide that 24 hours of request because they know they're going to be out for an extended period of time, and they may still be able to do their work, and so they would help them not be able to fall behind. We would recommend it not be available for absences due to vacations. If families go on vacations during the school year, that's great. Then they should enjoy that time with family. But to put that pressure onto the teacher to have that link available for the student, to make sure they have it available for the student each hour or a certain hour based on a family vacation piece, we are not recommending that would be eligible for families based on our discussions with our staff. So as I think of school operations recommendations for 21-22, we would look at having regular school schedules. So we would go back to various events, activities that we currently have. I talked a little about that. Social distancing restrictions. We would move away from 6 feet distancing. We would move to our typical 2 to 3 feet, or people working in small groups, but still using our classrooms. The buildings would slowly be reopened to visitors and classroom volunteers. So that's something that we've talked about, that would be of classroom volunteers is up to teachers then, their comfort level and the number of students they have in the classroom. May or not occur across the district, but we would slowly reopen for those things. And then field trips would be allowed with principal approval. One of the things that we talked about as a leadership team is that COVID did highlight the benefits of virtual tours. And are we required to go outside of the district for a full day for a field trip that maybe could be done virtually and have the same academic benefit, social benefit that would go with that? But there's some pieces that no, it's best to be in person. So the principals would have a more discerning eye on approval for field trips. And then, once again, you see this abrupt or sustained increases in COVID infections in the community may result in modifications to these practices. So this is where we are at this time. If we were starting to see COVID cases, or if we saw a spread, similar to last year when we had 8th graders, that we started to see a number of 8th grade students come down with COVID. We immediately went virtual for a week for that class, which resulted in us continuing to keep the rest of the district open, brought the 8th graders back, and we did not have an issue moving forward. So all of these recommendations would be with that caveat that we are going to be monitoring the various pieces that we have. Because we are recommending that we change some of our mitigating factors. Specifically, it was hard in some of our classrooms to be 6 feet apart anyway, so that's not the biggest change, but obviously the face covering requirement is a change that is a different piece that is not part of our recommendation. We've continued to do our periodic disinfecting of common touch points during the day using our electrostatic sprayers. We would have nightly deep cleaning of all of our spaces. That's something that we would continue doing. We have MERV 13 air filters in place. We would continue to do our outdoor air ratios of 50% with that early morning 100% air flush. So throughout the day, we're having air ratios of fresh air and building air recirculating. We would have hand sanitizers available in every classroom. One of the things that Topher reminded me of is that we would continue our use of our bipolar ionization system. That was a large purchase that the district made in excess of $150,000, and that is one of those pieces that we believe continued to keep us safe to stay open. It will be optional for staff if they want to disinfect surfaces between classes. If staff choose to do that, then we would provide the materials for them to be able to do that, just like we did this year, but it would be optional. There's been evidence and research that would say that that has a very, very minimal chance of spread, so that would be something that would be optional for staff, but these are the pieces that we would have across the district that would go with that. One of the things that we wonder about is athletics. I've asked Mr. Moore to come up and talk a little about this. This is something that we do not have all the answers for currently, but we do have some guidance from WIA, and I think we're expecting more in the future.
Yeah, we are. So, as you recall, a popular topic around this time last year, amongst other things, was how do we handle athletics and activities and places where a lot of people gather, right? So as of right now, currently all North Shore Conference, and of course for football only, we will be a member of the Woodland Conference this year. Events are following a traditional schedule. So last year you saw a lot of conference only or competition that was geographically very close to us. This year it's opening up to a little bit more of a traditional schedule, as in some conference opponents, some non-conference opponents, so on and so forth. Any potential modifications to schedules, spectator guidelines, et cetera, will be discussed at our August conference meetings. We want to be very consistent with the other districts in the North Shore Conference. We want to be consistent with the schools in the Woodland Conference to make sure that we are following guidelines that we can all agree upon. We all agree that are safe, and we all agree that are best for our communities. The WIA has given us some guidance. We expect more. That they have met with DHS and they have met with their medical advisory board, and we'll be communicating with member schools. As of right now, they've sent us some communication, just letting us know that for fall sports, in their words, normalization is being recommended with a few caveats. And part of that is following guidelines of our local health authorities, our department guidelines, and then continuing best practices that we really found going through this process last year. Things like just disinfecting, wiping down all equipment, trying to reduce hand touching as much as possible, encouraging some semblance of social distancing during practices, and so on and so forth, and following practices like proper hydration techniques, not sharing water bottles, things like that we can say common sense, but we can put emphasis on as we go throughout our seasons. So that's really where athletics is at this point.
And then one of the discussions, thank you, Mr. Moore. One of the discussions that we also had as a leadership team was in the fine arts area. And there doesn't appear to be as much of a concern with the band program, but with choir and singing. And so that is still something that we don't have an answer for, what that looks like. So at this point, we'll be working with our vocal teachers to develop some guidelines about that and what that looks like. But we are also aware of the fine arts that were impacted in our school system, and although we were able to offer pieces to them with some various mitigation factors in place last school year, and we will do our best to continue offering those things, but that is one piece that we don't have the answer to. And as I mentioned earlier, I think if we've learned anything last year, it's that we need to be flexible, that we need to be able to have plans that allow us to pivot, that these plans are not set in stone, and maybe although there aren't as many unanswered questions right now as there were last year at this time, because there was a lot, a lot of uncertainty, there are still a number of questions that we don't know the answer to, that we still need to work with our staff, work with the health department on, even whether we look at athletics. So we're still in uncharted waters. It's impossible to predict the unpredictable. So we don't believe the pandemic is over, but we do believe that we're heading in the right direction with vaccinations. We believe that the mitigating factors that we have in place would keep our students and staff safe, and that's what led us to bring these recommendations to the board and our community.
All right. Thank you, Jeff. So I think what I'd like to do now is ask if there are any immediate clarifying questions from board members. I mean, just anything that you heard now that you'd want some clarification on. Then we'd hear public comment so that we have the totality of all of the elements that we need to consider in our discussion, which would follow the public comment section and perhaps take action from there. So are there any immediate clarifying questions from the board?
I have one way back at the beginning with the close contact. Again, just to clarify, if there's a positive COVID case in a classroom, the whole classroom is notified. Is that what you were saying?
That's correct.
Versus before, it would have just been whoever was in like that 15 minutes and, right?
Yep,
Okay.
so before it would have been, well, it would have been, the families would have been notified that they were a close contact, that we had brought measuring tapes in, measured, even looked at video cameras to say, you know, where is that at, depending on where it was at. But then we would have notified across the district that there was a COVID case as well. You know, so this is a piece where we'd say it would be the people that are close contacts would be those in a classroom. So it may be, if it's at the high school or secondary level, it could be multiple classrooms. If it's at the elementary level, it would be in that grade level classroom where they'd be notified for that COVID case.
Okay, thanks.
Will kids be going back and forth through classrooms depending on different groups that they're having? I know we stopped it last year with COVID, but will there be different, like, reading groups in the same grade level?
Yes, and so at the end of the year last year, we kept it to less than 15 minutes, but what we saw is some of our most needy reading students who needed intervention really needed to be able to be in a small group to be able to get that intervention time. So now we would move back to that. We would know that those students, if they were in close contact, we would know that, and that would be similar to the secondary level, and that would be an extra layer of notifying parents that someone had contracted COVID.
Because there were efforts to make kind of these cohorts of students.
Correct.
To limit exposure, so to speak, right?
Yep,
And
that's correct.
That is not,
That is not part of
something
our recommendation and our plan moving forward, that we would, we cohorted a lot across the different levels, whether it was at recess, lunch,
right.
not sharing students, some of those pieces.
And like collaboration rooms here, I'm just trying to think of a typical day, the student who rides the bus will come in on the bus, they'll have their mask on, they'll come in. Last year, we had traffic flow in the hallways, that's, you know, you want down this side and back the other side, that's not.
Yeah, but the secondary level, that will not be true. The building levels are working on various pieces. So in the past, at the elementary level, students would have gone into the gymnasiums and waited for the bell to ring and then go to classes. And I believe both buildings have met with their leadership teams and have getting the nod, yes, that the students will go directly to the classrooms like they did last year. That was a better start to the school day. It wasn't students in a big, huge setting getting amped up and then going into a classroom setting. That will also help with the mixing of students in a close setting, but they'll be going directly to their classroom. But buildings will have their own procedures that they'll work with their leadership teams to develop.
But some of the updates, you know, with the collaboration space here, or like at the middle school or elementary school with like number corner, all those things probably would be taken more advantage of.
That's correct.
This year than in the past.
That's correct. And we can see, and as we even talked about that as like a soft rollout, not that we're moving directly into this. We even said, like, you know, in the past, we would have a welcome assembly. First day of school, you have everyone in the gymnasium. Well, we're not going to do that. Doesn't mean that at some point we're not going to have an assembly, but we aren't rolling that out on the first day of school. We've figured out a way to do it in different ways, and so that's how we're going to start our year. But so there are things that in the pre-COVID world that we did that we aren't moving forward with immediately. As we roll out some of these other factors, we want to make sure that we're keeping students and staff safe and aren't having an outbreak that goes with it. So
And like seating at lunch and the lockers
Correct.
and all those extra measures.
we will not have, our recommendation would be not to have stickers on the various chairs as we move forward.
On the slide that's up, if students do determine to self-quarantine, is there a period that they have to do that for? So, I mean, can they be out for just one day? Is there a max or a minimum with that?
Yeah, Laura, can you help me? There is a number.
Since it's a parent's option to do what we really aren't going to require them to be out for a certain amount of time, it's their option to take their child out, so there really wouldn't be a recommendation for a number of days.
Okay.
There's a number, though, that's recommended that if you were a close contact, you would quarantine for how many days?
10 unless 7 with a test.
So it's a similar piece there. So this would not be something whereby someone could say, I'm gonna self-quarantine for 2 days, and then I'm gonna come back in. Like, if you're gonna self-quarantine, and if they choose to do that, then that would be a discussion the office would have to say, when this happens, then you need a self-quarantine to be out, because we aren't gonna have teachers having to remember or not remember what's going on that goes with it.
Okay.
How, I don't know if there's really a way to answer this, like how much, you have a teacher in a classroom and there's a student that has symptoms, maybe there was a positive case that went home the day before, and then the next day, someone else has symptoms or is showing symptoms, would you be pulling them?
So we'd be
Like how-
following.
you know what I mean?
Yep, I do. So it'd be similar to what we did this year, where we would say that when students had symptoms now, when they had 2 or more symptoms and they were sent to the office, parents were contacted to say, you need to come and get your child, and before they can return, there's pieces that you need to do for that. So that's what I'm saying, we'd maintain that enhanced symptom monitoring, where before we didn't do that. We would just say,
gotcha.
you came to
Okay.
school, you have a runny nose and you're coughing, well, hopefully you don't cough on someone else, I guess, right? I mean, that's what we would say, and that's what germs would spread. Or someone would say, well, they threw up this morning, but now they feel better, so I'm gonna send them to school. Like, that's not, those would happen, and we'd say that's the enhanced pieces. We're saying, no, you need to stay home, and then we'd encourage you to get tested if you have multiple symptoms before coming to school.
Okay, thank you.
In the virtual learning option, the videos are actually video feeds. They're live feeds of the classroom, right?
Not of the classroom, of the teacher.
Of the teacher.
Yep, because the student
right,
confidentiality
right.
would not be of students. Yep, that's correct.
But it's a live feed.
It is, and that was one of the
Okay.
pieces that we had to train teachers on, is camera can only be on the teacher. If you can start hearing students, then, or teacher, there's an issue in the classroom, teacher has to turn the mic off so that nothing is heard, that would discern students, whether it's with acting out in class, or if even a student is leaving for an intervention. Like I mentioned earlier with reading intervention, they can't be identified with that camera.
A question for Kevin. Is the WIAA made any recommendations regarding masks?
The WIA is encouraged masks, if not vaccinated, encouraged not to.
If not vaccinated?
I'm sorry.
If not vaccinated. Other clarifying questions? Okay, then at this point, I will open this up for public comment. I'd ask that if you'd like to speak, you come forward, you state your name and your address, and we'll listen to your comments. And there's not, how many people would like to speak this evening? That's, okay. I mean, generally, we try to keep it around 3 minutes. We don't have thousands or hundreds or tens of people that want to speak, so we'll provide some leeway there. But again, name and address, Kara, is all we need. All right, so with that, we'll open it up for public comment.
Good evening. My name is Jennifer Shimon, and I live at 1512 Audubon Avenue. And I have an incoming freshman to high school and a 5th grader at Woodview. And my concern is for my 5th grader. It takes a lot for me to be here and to say something. This is not something I like to do, and I don't enjoy a fight. For that reason, I needed to write down what I wanted to say. I don't understand in the proposed plan how health and safety can be listed first under the planning priorities, and then a few slides later, there's the Washington Ozaukee Health Department guidance, which recommends the consistent and correct use of masks. and yet you're suggesting that masks should be optional. Those two things are contradictory. You can't rank safety first and go against what is recommended for safety. And by leaving out a virtual option until vaccination is possible, the people that would like to follow the guidelines of the scientific community have the choice of homeschooling or to hope for the best by sending our kids in person with no mandate. Maybe summer school went well. Maybe it'll all be fine. But you are going against CDC, Health Department, and the American Academy of Pediatrics recommendations. By doing that before vaccination is a possibility, it leaves a gap in protecting our kids. To me, it is abandoning this age group simply because you are tired of masks or because you think it is safe. That isn't a good enough reason. Saying that you had a small study of your own with summer school and it went well, so you conclude that it is safe does not really reassure me. Things are changing fast with the variants. I would think that the district is opening themselves to liability to ignore recommendations. Even if the chances are small that a child in Grafton contracts COVID, do you really want to take that risk? Do you want to regret that reasonable precautions were not taken when they so easily could have been? I would not want that on me. All we need is a couple more months. Years from now, I may look back and see that we were overly cautious as a family. But if I can say that I did my best to protect my family and the vulnerable people that I work with and my community, then I'm okay with my decision and how we chose to behave towards other people. Extended mask wearing for a few more months is a small price to pay if there's even the possibility that it might protect one of our kids. Thank you for your time.
Thank you.
Hi, I'm Carrie McClung. I live at 1816 Riverbend Road in Grafton. I'm a parent in the community. I have a daughter who is in middle school, and I have a daughter who's will be at the elementary school in second grade. Before I go into what I really came to say, I do want to mention something that I think is important for all of you to consider when you discuss this concept of optional masking, especially at the elementary level. So my daughter went to summer school, and I tried to get her to wear a mask on the first day. And she came home without it on at the end of the day, and I'm like, why didn't you wear your mask? Well, we didn't have to. I mean, nobody's enforcing it. So for parents like myself who are concerned about COVID, it's incredibly distressing to think that the only option I have to keep my elementary school child safe is my ability as a parent to try to enforce my child wearing a mask when I'm not there with her for those 8 hours. So the school district's decision, or the district recommendation to move forward this fall with optional masking is disappointing, and it's something that concerns me particularly for the elementary schools. As I think has already been mentioned, both the CDC and the American Academy of Pediatrics have released new guidance in the last couple weeks regarding COVID prevention in schools, and it touches on unvaccinated populations. So as of July 9th, the CDC states the following in their guidance for COVID-19 prevention in K-12 schools. Consistent and correct mask use by people who are not fully vaccinated is especially important indoors and in crowded settings when physical distancing cannot be maintained. Indoors, mask use is recommended for people who are not fully vaccinated, including students, teachers, and staff. As of July 18th, the AAP states the following in their COVID-19 guidance for safe schools. All students older than 2 years and all school staff should wear face masks at school unless medical or developmental conditions prohibit use. They then list several points that support their reasoning behind the recommendation of masking for all staff and students regardless of your vaccination status. And I want to highlight one of those points in particular. It says the AAP recommends universal masking in school at this time for the following reasons. A significant portion of the student population is not eligible for vaccination. And so this brings me to my main concern around this optional masking in the elementary schools. None of the students who attend any of the elementary schools in this district, with maybe like a few exceptions I would imagine, will be eligible for a COVID vaccine until sometime this winter potentially. So I guess I don't understand what the district justification is for making masks optional at the elementary level. I understand the justification at the middle school and high school level because those students have the option to get vaccinated. But if you look at the recommendations locally, if you look at the national recommendations, it seems like the district would can want to continue to have a policy to require masks at the elementary level, at least until those students can get vaccinated. Otherwise, it just seems incredibly risky to me to make it optional. I also wanted to touch on a couple things that I noticed in the presentation when I was looking at it today that I think are kind of misleading around summer school. It's not the same thing as a typical school year. So I'm glad it's positive that there were no cases during summer school when the masks were optional. It's not really a one-to-one comparison, in my opinion. Summer school is a small subset of the student population. Many of these classes took place outside. Obviously, that's not an option during the school year for probably most classes and for most of the year. Summer school is for 4 hours a day. It's optional to attend all 4 hours, or there's like 4 classes from like 8 to 12. So, the amount of time you spend in a classroom is less. The sessions are like 2 weeks long. I think there was a break in between at least 2 of the sessions, like a week or a 2-week break. So you kind of have some natural breaks. And from what the guidance, the instructions that we received for the summer academy, it said that we were asked to report illness and to keep our kids home. But there was not a requirement for us to inform the school of any COVID infections. So to me, that means there were no reported COVID infections. So I feel like that should be clarified. The presentation also states that the optional masking policy may be modified due to abrupt or sustained increases in COVID infections in the community or the schools. What's the criteria the school is going to use? At what point, what's the threshold of cases? When do you say, okay, now we need to go back to masking? And how difficult will that also be, particularly at the elementary level? It's not easy to get a little kid to wear a mask for 8 hours. I do understand that. But if you start out not wearing them and you have to turn back to that a month in, it's going to be way more difficult. And I guess one of the main reasons this is really bothering me is that, the COVID infection rate is increasing in Ozaukee County. So as of July 22nd, like you saw on the slide, the Washington Ozaukee Public Health Department listed the burden as moderate, and it's increasing. It's been increasing all summer. So I cannot understand how, with the current COVID infection rate increasing across the county, across the state, across the country, and there's no vaccine available for students under 12, how can the district in good conscience believe that optional masking at the elementary level is a safe choice for this fall? I just really implore the board to look at all of the local and national recommendations and all the guidelines around COVID prevention for K-12 schools, and particularly for elementary schools, and consider making masks mandatory at the elementary level until there's a vaccine available. Thank you.
My name is Michael Balin. I live at 1502 Audubon here in Grafton. I've been a hunter safety instructor across the street over here for over 40 years, okay? And if my statistics for teaching hunter safety are like the statistics that I saw up here that said, is it 15%? Of the people?
Last year.
Last year, 15%. That would be 1 out of 7. If I had 1 out of 7 students that I'm teaching hunter safety to that were injured in a hunter safety incident, they'd shut down the program. This is terrible. And especially since the younger kids are not eligible for vaccination. I do not have any children in the Grafton School District. I live here. My kids have all graduated and gone off, and they have kids in other school districts. And it's frustrating. 1 out of 7 is terrible. And this format that was set up here was done back in May. Since then, the Delta variant has spread across the country, and the state of Wisconsin is going up with the Delta variant. Does anyone on the board or the administration here know what the Delta variant is going to do to the students, especially since it's going through younger people and it is causing them to be hospitalized? I strongly urge that you put in a mask requirement. I can't understand. I heard a number of people here talk about the fact that the mask requirements, you know, they have difficulty with smaller kids. I'm fortunate that my grandchildren all go to schools that had mask requirements. They all wear masks. It's not like in here, I see everyone has shoes on, everyone has a shirt on. Why can we not require at least masks? And anyone that's teaching that's over the age should be required to be vaccinated. So that's my comments. It's just, I'm frustrated. It's 73 years old. I'm afraid of getting it, and I've been fully vaccinated. Thank you.
My name is Keith Shimon. I live at 1512 Audubon Avenue. Mackenzie Shimon is going into high school. My son is in the 5th grade, Jack. And just some of the statistics that have been coming out over the past couple of weeks about the Delta variant. Been interesting in Singapore that 800 kids have died from COVID. And the mass majority of the deaths have happened over the past month. That's it. Thank you.
Any additional comments this evening? For public comments relative to the reopening plan? Okay. Okay, thank you for sharing those comments. I will also note that I did receive and believe forwarded on 10 comments, of which one was stated this evening, but the board should have received all 10 of those, in addition to what you heard this evening regarding the presentation. So at this point in time, then, I would open it up for discussion regarding the administrative recommendation regarding the 2021-2022 school year plans. Thoughts, comments, additional questions?
Is there, I mean, I guess beyond what you've shown in the slides, why we're not off doing masking for elementary, or mandating masking for just the elementary level? Is it
Yeah,
the same?
the spread was the least, so I found the slide
Okay.
the gentleman was referring to. It was 15% of adults who had it. It was 8% overall, so I just didn't go back far enough, so I thought
There
it was
you
right
go.
there. So there was less students at the elementary level. There were, that was the 5% level. So there were numerous districts, whether it was in Waukesha County or in Washington County, that in May went masks optional and did not see an outbreak in any of their schools. And then move forward into that summer school as well for those districts. So there, although we stuck with face coverings all the way through the end of the school year, there was a number of schools, whether it's in Waukesha or Washington County and maybe other districts as well, but none that we would compare ourselves to that had moved in that direction as well.
For the parents that do send their kids to school with the expectation that they will be wearing a mask, is there a way to work with the teachers on that to make sure that they are aware of that? That it's the parents' expectation that the student will be wearing one?
Yeah, I mean, I guess it'd be, it'd be something that if the student wasn't, the teacher would have to work with the parent to figure out what a natural consequence would be for that. Because you wouldn't want it to be where it's appearing as though the teacher is punishing a student when other students aren't having to wear a mask. And so if someone were to choose to say, and I saw students in summer school that were wearing masks, and they were working with students who maybe did or didn't have masks on, but that would be a situation whereby I wouldn't want a teacher in a spot where they're trying to discipline a student for something that other people aren't, and then the kids wouldn't know why is Susie in trouble for doing something that I'm not doing. But they could work with families to give that feedback and work together on a solution for that.
Okay.
There's other instances that we've done things like that before we had face coverings.
Were there any discussions when you talked to administration and staff about outdoor classes? I know we did a lot of that last year, trying to reduce the risk. Has there been any talk, or was there any talk of trying to do more things outside this fall when the weather permits?
Yeah, I mean, that was a discussion that we had with our summer teams, was there are certain classes that do lend themselves to doing that. And I think there's some pieces that go with still continued instruction. There's some other pieces that maybe don't go as well with that. I mean, because we did talk about, I think Mr. Deering is specifically at the middle school talking about not having a mask break for every class. So the loss of instructional time that occurred there. But is there opportunities to be able to be outside when possible? Yeah, definitely. And that's what I said, even with some of our specials, reviewing what is the best practice for having those classes. Viad, obviously, it's pretty easy to go outside. The vocal and instrumental music pieces are the things there. Art, it's harder to go outside, but there's some times you could do that. But in the core classes, there are times you could do it, and that'd be up to the teacher's discretion to do that.
Is it possible to continue the maybe cohort for elementary, as another possibility? Was that discussed at all?
It was, and
Or with the other schools, like at the end of last year, was it just mask optional that changed? Like, were they still cohorting? You know what I mean?
I do, yeah. I know the schools that I know of that went mask optional, then, I mean, they like turned their bubblers on. I mean, everything went back
Just
on.
went back, okay.
And, that's a small example, but yeah, they did the cohorting, they moved away from that. Could we move forward? If the board would say we want to start the year with cohorting, definitely we could do that. I mean, we could start the year with that and to see if that's a mitigating factor that works. That was one of our mitigating factors. There's a number that we've kept, there's a number that we aren't recommending that we keep. But that's one that we could easily work with staff to be able to limit the crossing, especially at the beginning.
So the idea of that would be, if someone was a close contact, we'd be able to track it and let them know if we're cohorting versus the whole class?
Well, the idea of the cohorting last year was so that if someone did become infected with COVID, that it wouldn't transfer throughout 2 different classes, so we'd close down maybe 50 kids. It never occurred like that. There would never be more than a couple kids that were in close contact.
Limited the number, like the 794 instances of quarantines that we had.
Right, yes.
The reason that number was 794 was, and not double that or whatever, is because of the cohorting, right?
Yes.
And otherwise, you'd have to say everybody was, which is kind of what we're saying now, is if you're in the class and you're all going to get notified.
Right, we did the extra work that went into, like, instead of saying, if I become sick tomorrow, then it's really just Topher and Sean, wow, I'm sorry, a little brain freeze, that we would contact, where we'd say, all of you would be a letter saying, someone in the class had COVID. So the pieces that went with the contact tracing that went with that, we didn't see that as being the best use of time.
Because we had 794 kids that we sent home that
Didn't miss school.
And how many of them ended up with positive tests during that period?
Right, that's what we had, 0.
To the best of our knowledge.
Correct, that's right. And discussion that we had is, were the masks that big of a deterrent? Like, that's and we had that discussion, right? We've gone back and forth on this discussion. That's why I say, like, we are aware of the mitigating factors that we had in place last year. We are in a similar situation as we were last year, whereby local control has been given to each district, because no one has said, you have to do this. Whether it's a national level, they're making recommendations because it's a national issue. If I'm watching the news last night, they're saying 40% of all new COVID cases are in 3 states. So there's 3 states that are having a massive outbreak. So they're having to make decisions about nationally, here are best practices. Local, at state level, they have to make recommendations for at the state level, because there's different counties with vaccination status and different practices that go with that. You know, that's why you had such a variant of our district being open every day, our district having in-person board meetings every month, some districts still not having in-person board meetings, some districts barely getting into school at the end of the year for in-person learning. It really was a local control issue, and although at times it would be nice to say, well, here's the rule, and here's the evidence that says that, and we need to follow that, and that's what we go towards. In this case, the local control is, you have to look at the recommendations and make a decision based on that. So there's a lot of gray.
I think it'd be safe to say that if we had followed the recommendation of the Washington-Ozaukee County Health Department last year and CDC, we would not have been open.
Correct, that's true.
I mean, there's no, that's not even debatable or questionable. I mean, the case rates and the transmission, the spread as reported by their own websites were well beyond their own guidance as to whether or not this school or any school for that matter should be open. I mean,
Yeah, that's where I was going at. I mean, I think at one point we were 7 times the Washington County Ozaukee Health Department's recommendation for when we should have been completely virtual. And
Right, and we had those discussions, because if you remember last year, it was 2 days a week, we would get together for a conference call with area superintendents, and then we would have the health department join us on those discussions, at least one time, if not both times. And that's what they said, is you had all these different, even in that, you had the Harvard model, you had a Minnesota model, there's all these models across the nation that people came up with, but partly because there was the feeling that if we get to a certain level, we get to this critical level, the hospitals are gonna be full, and it's just gonna be ravaging throughout the community, and you're not gonna be able to have school. And that ended up not being true. Even when we hit that critically high level, it wasn't impacting at the school level. It was in the community, but you didn't have the spread that you would have thought. And that's where it wasn't that you've never had this happen before. So they're making their best guess on what was going to be the best practice to follow to keep people safe.
I think I've asked this before, but is it possible to get somebody from the health department to one of our meetings to have this discussion with them? Or at least to ask. I know you can't say it's
Nope, I'd be happy to invite.
Because I guess I'm curious, we keep talking about cases all the time and how many cases there were, but we're not talking about, I think I must have asked this maybe 3 straight meetings of, we had X number of students get COVID, and I mean, how many of them were in the hospital, how many, I'm not familiar with anything else where we're tracking cases versus, you know, what the outcomes are. I mean, now we're talking about the Delta variant, and I'm not an expert, and I know we hear from a lot of experts, and did last year as well. I think since the start of COVID, it's 340 deaths for students under, or for 18 and under. That's out of 75 million. I think pneumonia is 2.5 times that. So I guess my thought would be the same as it was last year. If there's any measures we're taking for that, then we sure as hell better be taking them for pneumonia or whatever else we're looking at, versus just cases, just saying, well, this person got it. Well, okay, if my 6-year-old got it and was home and fine, why should your kid have to do these 6 things? I would just want to follow it to its logical end, not just say, you know, well, let's just wait till everyone can get vaccinated. I don't see the logic in saying when there's a vaccine for under 12, if the vaccine's not mandated for under 12. So that wouldn't solve that problem then. You could say, well, we can go without masks once there's a vaccines for kids under 12, but why? Why would we go without masks until we knew every single person was vaccinated? But then there's also the concern that, I mean, you can still get it because the vaccine's not perfect.
Right. But, I mean, also, part of it is they're not eligible to get the vaccine. So at least you want them to get the opportunity to be vaccinated. The families would like their children to have the opportunity.
Sure. But,
So, I mean, why would it matter? I mean, it matters to people.
right, and
You know,
they're,
it might not matter, like maybe, someone won't be sick, but someone else could really get sick.
right, and so I would say that we should make sure that we have somebody from the health department in to let us know about, things that are perhaps more serious for school-age children, that we could be doing stuff to
Compares.
prevent. What's that?
Like how it's comparing is what you're,
Well, I mean, if we're gonna take measures to, stop somebody from getting a positive case of COVID, then
why not
wouldn't
do
we
it
wanna
for it?
stop somebody from doing something that might actually be significantly more, deadly for somebody under 18?
So your point is that it's not just the frequency, but the severity.
I
We
just
should at
don't know of
least
anything else when we
understand-
talk about how
Right,
many cases.
Agreed.
I mean,
I don't disagree with you, Jerry. At the end of the day, is the board's expectation that we would put in mitigating or preventative measures until there were 0 cases.
Right. Like how much do you do for how long?
Right.
Yeah.
Well, and why just this?
Yeah, but no, that's a good point. If there are other conditions that may be more severe, wouldn't we also implore administration to look at preventative measures and mitigating measures to minimize the impact of those things, whatever they may be, the flu, pneumonia?
I think part of it is the unknown with COVID, because it's still, we're still learning about it versus like pneumonias, flu, we know.
But there are data points that we can draw from, our own included, 5% at the elementary level, right? I
Oh,
mean,
yeah, no,
severity is a
I
question, it's a
agree.
great question, I don't know.
Yeah.
Of the 5% cases that we had, did they result
Locally,
in
we're not seeing,
one day of missed school, were all of them back at the end of their quarantine period without any significant challenges? And I know, some of this is, of course, covered by FERPA and FERPA. I can't say that it would be HIPAA, but certainly FERPA. But that is not an unreasonable question. From my perspective on the contact tracing, why not contact trace positive cases in a hybrid approach? I mean, I understand right now that, or last year, the way we did that, at times we were getting the tape measure out and we're keeping people physically separated. At least then we were being very particular about who was in close contact and who wasn't in close contact. Here, it seems we're going all the way to the other end of the spectrum. We may know who was in close contact either by virtue of asking a teacher, asking a student. Is there a hybrid approach that we'd say, well, at least we know that these people were in close contact and they should be quarantined, as opposed to leaving it up to just personal choice, number one. Number two, if I've got 3 kids, I've got 4 kids, none are in the school, but if I have 3 kids, one is positive, what about the other 2? I mean, logically, and maybe not logically, can they be quarantined in their own household? I don't know. But if one of 3 is tested positive, can the other 2 come to school, so long as they're not presenting symptoms?
Yeah, and so you have 2 questions there.
Yes, there are 2 questions. Sorry.
The second one, we've discussed that, we don't have an answer for that, because there does seem to be a household spread, which is where you saw some of these cases come from. So we did see where, not always, because there are instances where people were in the household and didn't get COVID, even though someone was positive in the household. That is one question that we didn't, as I said earlier, there's a lot of questions that we may not have answers to. That's one of them. The first question that you had about contact tracing is we could do that. And the issue is that if we stayed with it's still self-quarantining, then yeah, we could go off of people's words. Because most of the time, kids are going to be like, I wasn't 6 feet, and I wasn't 6 feet with Sean. I can share. One of my kids had that issue. I wasn't 6 feet. Well, sounds like you were, because the principal said you were. So I guess you're staying home, like you're quarantined. But if it's self-quarantining, then that'd be different, because we would tell people that you were a close contact and you can choose to self-quarantine. But if we're gonna go off of people's words, and then we're gonna make them quarantine, that's not a good fit. So if the board were to say, well, we still want you to contact trace, and go back to how we did contact tracing, which would be different than this, where we would measure, we would contact parents, they would have to quarantine, then we would just have to make sure that we have the people available to do that. We would have to look at our staffing pieces which is what we did this year, that we had staffing to do that. We would have to review that to make sure we have enough staffing. But the issue that the reason why we said not to require quarantining is we did require quarantining, and that didn't result in spread. And because they didn't come down with COVID. So we had data points that said that wasn't the best use. But could we do a better job of contact tracing? Sure, we could do that. But do you see sort of the push-pull that goes with that?
Yeah, no, I do, thank you,
Yeah.
yes.
So we have discussed in detail a number of these topics to try and come up with recommendations for the board to consider.
Yeah, I think there would probably be more merit in the family spread than the contact tracing. I think it's more likely that I think we witnessed it. I mean, I witnessed it on my street.
Sure.
You know, somebody within that family gets it, well, it naturally spreads. Now, this year, it probably wouldn't spread as much because you probably have some older siblings that are vaccinated. So the spread is less likely to happen within that family household, I'm guessing. You know, just naturally, based on vaccines, those that have already had it, I wouldn't think we'll see as much family spread as we did last year.
Right, especially with the data point of saying that there is the number of people that have the dose, right? You're almost at herd immunity for 18 and older already. And so that would help with that.
Yeah, I mean, I totally get it, and the elementary kids are the ones at risk because they don't have the ability to be vaccinated. I look at the numbers and I say the chances of this becoming as proliferant as it was last year are not as likely given the vaccination rate in the county. And I think that's where, you know, we're talking about local control, and, you know, you go to a different part of the state,
Right.
and it's totally different because they're not vaccinated. Fortunately, in Ozaki County, we have a high vaccination rate. So I think the chances of spread are not as likely, but I'm still concerned about those elementary kids. That's where I'm torn.
And we would echo that. I mean, that was our discussion, because I think that even if there is a vaccine by winter, you're at least a month out for kids being fully vaccinated. They get the shot, wait 2 weeks, get the next shot, wait 2 weeks. So you're through the semester. And what percentage of our families are going to have their 4 through 11-year-old get a shot immediately that goes with that? I don't know what percentage that would be. It looks like 50% of our residents from 12 to 17 have had one dose, and 45% have completed the series. And that could be much higher because you've had enough time to be able to do that. It's similar to a flu shot. How many people get the flu shot that go with that? What percentage of our youngest elementaries will get it? I get that it is something, though, that we're saying you don't even have an option of getting it. So I would get the shot, Jeff, and you're not even giving me that option because it isn't there yet. So we understand that, we hear that.
In regards to the homebound application for virtual learning, is that an application that already exists?
It's an application in progress that we can quickly finalize, yes.
Okay, and it requires a medical reason from a physician. In light of the AAP guidelines, if a pediatrician simply says, I advise all of my patients to not have their child, or I advise all of my patients' families to not not go to school with masks in a personal setting until there's a vaccine. Will that meet the definition of our homebound application?
Yes, we still have to run it through legal, so
Okay.
that's one of the pieces that we need to make sure that we finalize. So that's a piece that we haven't done, but we need to run it through legal. But that's why that's on there, is because it is a doctor's rationale, and that's, if families have that level of concern or that level of potential issues in home or in their personal lives, whatever it may be, to be able to go through that step is something that we believe is meaningful, and we would, just as we do with other situations when kids go on homebound, we don't make judgments on doctors' notes. It's very, very rare that we do that.
Okay, then a follow-up to that, in light of the fact that there is representation, at least, of a vaccine that may be out as early as winter, would there be some logic to having at least an opt-out at the end of the semester? Opt-in and opt-out. I mean, right now, it's you're in or out for the entire school year. Would there be some logic to saying, no, just like we did last year, we did it multiple times, I don't know how many times, quarterly? I mean, would there be some logic to,
But I think the concern there would be, if we say that, I think what we ran into this year is that there is hope that there might be a vaccine by winter. It is definite, not a definitive, like, I guarantee you there's going to be a vaccine by November or December. You know, it could get pushed out till January. I don't think anyone knows for sure. And if we say you can come back at the semester, we had people here, nothing had changed. And after a quarter, they're coming back. You know, like, really nothing had changed. And truthfully, they were coming back as we were spiking. Like, people who returned in November and December were returning to a very high, we were at the highest level in the state. I mean, our state was high, our school was high. I mean, we were still low compared to others, but we were at our highest level. As we said, Washington and Ozaukee County were in the critical, and students were returning. And that was one of our problems for our teachers, was that a family makes the decision and then they change their mind, and it's not for a medical reason. I mean, they changed their mind, it wasn't working, and I totally get that, but it was so hard on our teachers. So if we say you can come back at the semester, we may not even have a vaccine at the semester. So do you come back and, okay, I chose not to have my child vaccinated, but they were out for the semester, but now I'd like to come back in. It does throw off classroom balance. There is a big consequence when we have kids coming in at the semester.
But wasn't that when they were going back and forth, well, I'm not coming in today, and I'm not, you know, when they would come back and forth like every other day, or say every other week? Wasn't that part of the issue, not just?
Yeah, I don't think it was coming back every other day, but I know what you mean.
Right.
But I know what
You
you
know,
mean.
it was
But
just like,
it
okay,
was
I'm gonna be out.
the frequency or the intermittent pieces that would
And
go
I
with it
think
that really
that's where
weren't
the issue
relevant.
was.
I think it'd be really hard, though,
Yeah.
to
No.
switch, like, if you
Yeah.
have, let's say, 6 first graders who decide, I am not gonna be there in first grade, you know, I'm not gonna be there for the first semester. Great, and we do all this stuff. Okay, 3 decide, in January, we are coming back. Oh, okay, now you have 3. A teacher who had been teaching 6 is now gonna be teaching 3, and you have to figure out how to get those other 3, where are you gonna put them? Like, physically, where are they going now? Because you.
But I'll just push back on that. That's a manageable consequence, in my opinion. At the end of the day, what if those 3 got a vaccination? And now they feel perfectly comfortable being in school. Our policy now would preclude them from coming back to an in-person setting. Their medical condition now would be cleared, potentially, depending on what the application looks like. And they would be in a state, at least that may have given rise to the application in the first place, to be back in school in person. Isn't that what we want?
I think it's what we want, but do we say then the requirement is to come back, we want proof that you're fully vaccinated and you're no longer of a medical concern? Because if your medical concern was
I
like.
would say yes to the latter, not to the former. I don't want proof of vaccination, but I want proof from them that their homebound application is no longer valid, and it can be revoked once. I mean, what happens now? I mean, if somebody fills out an application now, is it, once you fill it out, you're subject to the terms of that homebound for the rest of the school year? I don't.
Well, under our recommendation, we don't have anyone doing this for the year, right, currently, I mean, right? I mean, so.
But we have kids that apply for homebound application.
We do, yep.
And
That's not typically for the year, is what I'm saying. Like, those
Yes,
are,
okay.
yeah, those are things that then you work with medical providers to figure out, what is this for? Is it the length of time? Is it a gradual return to school? Is it just a temporary partial day? Is it partial days throughout the year? Like, all those pieces. I mean, there are other districts that did not, that once you signed up to be virtual last year, you were not allowed back in. We were not one of those districts. We believe that if families, because of the uncertainties, they saw that, and it was ironic that I remember at Thanksgiving having a health department discussion with the health department saying, like, should we be worried about staff traveling? And the health department saying, what's hotter than Wisconsin? Like, so like if they're leaving Wisconsin, there's not more at risk than they are by being here. And we did have a number of families that, because it wasn't spreading in the school setting, they felt more comfortable, just because there's so many unknowns of what it would look like. And there's still unknowns. I understand that. I mean, I think that's what everyone's struggling with, is what are the unknowns, and then what's the mitigating factor that does that? Because we know that there is a, you know, I'm meeting with the Aurora the other day and speaking with them, as they know that the colds are going to come back because masks are not going to be worn across the board. So if you never want to have colds season again, then universal mask wearing would take care of that. That doesn't seem to be something that the overall community supports, that mitigating factor, in order to not have that. And that's where we're sort of trying to figure out what's the mitigating factor that we can live with, that still gets a safety impact that we can have, that we need.
Right.
So could we do semester? I mean, we can, sure, I mean.
What challenges?
But right now, we didn't have anything. We just had people say, like, I want to come back in, and then we'd say we have to wait 3 days because staff had to then reconfigure their rooms and set up all these different things in their groups and all those pieces. It'd be a little harder in our current mindset. Is what we're thinking is that if you're a first grader at Woodview and you're a first grader at Kennedy, you may not go to Kennedy if you're a first grader at Kennedy for that teacher. You may be at the Woodview teacher, because that's the person that's going to be virtual. So then that may impact class sizes or space issues at that school at semester, which isn't, once again, it's not insurmountable. I'm just saying the frustration that teachers may feel that go with that. But if you had someone, I guess if the board were to say you wanted it to be a semester, then I would strongly recommend that then there be some type of form that is then filled out by the medical examiner or the medical provider saying the situation has changed and this person should be in school for the rest of the year. So that they aren't coming back in and then we're coming back with another doctor's note a week later saying, I'm going to go back.
No, I would agree with that, but would you, I mean, if a vaccine comes out and now somebody is vaccinated, a second grader is vaccinated.
Before the year's over as well.
Before the year's over.
Yeah.
I mean, and you know, the only reason they're out is because there wasn't a vaccine for them. And because of our policy regarding optional masks, the family decided, you know what, my child's going to be virtual, but now I have the vaccine, and we're, you know, fully ready to come back. I mean, is there any estimation at this point, in light of the policy or the recommendation on the table, as to how many virtual students we might have?
So one of the survey questions that we asked our parents at the end of the year was to say, and the question was, if face coverings are optional for students and staff in the fall of 21-22 school year, I will be filling out a homebound instruction form in order for my children to receive virtual instruction for the year. We had 30 say yes, so 4.46% of our families said yes that took the survey. Now, I tried looking in the surveys of how many people we had taken. I couldn't figure that out because it's broken down by school with their responses and so forth. So I don't have a total number, but I do know that last year when we did the similar type of survey, we had about 20% say they were going to be virtual, and then we had discussions at the administrative level and support staff saying, well, do people really know what they meant by that? And people even said to me here, well, what is homebound instruction form? Did people really know what they meant when they said yes? But last year when they said 20%, we started with 20% virtual. So it may very well be that maybe 4.5% of our families across the board would be interested in, if face coverings were optional, they'd be interested in a homebound instruction form. At this point, we had 0 4K, 0 kindergartners, 4 first graders, 2 second graders, 2 third graders, 7 fourth graders, 3 fifth graders, 0 6th, 3 7th, 1 8th, 2 9th, 1 10th, 2 11th, 2 12th. Now, they didn't know at the time that if I say virtual, I can't be involved in extracurricular activities. So would that impact some that were in person? If the spelling bee's virtual still, then a kid could still be involved in the virtual spelling bee, because that'd be okay. It would be our recommendation, at least.
And did they know at the time that the recommendation was going to be, if you choose virtual, you're virtual for the year?
Yes, because it specifically said if face coverings are optional, then I would fill out a home ec to receive virtual instruction for the year.
For the year, okay.
Now, would we allow, if we did that, is it just at the elementary school? Because at the middle and the high school, can I say, like, truthfully, they'll have the option of being vaccinated at this point. Can I say a month or two in, like, if I get a doctor to say, like, nope, medically things have changed and you can, you know, whatever their reason was has changed and you can come back now?
Well,
So
if
is
you were to use the logic that elementary kids, I think you'd have to throw sixth graders into the mix, because there are very few sixth graders that are gonna be 12.
I do think if there are any exceptions made, it would just be that sixth grade and under.
Sure, yeah, I think the vast majority of kids that are gonna be older than that and have had the option. And I don't have a breakdown. It says 12 to 17 is 50% of Wisconsin County. I don't know what that means in Grafton, unfortunately. I just know that's all of the county.
Nor would we know what percentage of those kids are even in our schools.
That's true as well.
Oh, okay.
Yep, we aren't recording that. That's correct. We wouldn't know if kids that open enroll, maybe from other counties, we wouldn't have that data point either.
Jerry, just to your point, 1% of the kids 0 to 9 have ever been hospitalized in Wisconsin for any reason due to COVID.
Due to COVID, yeah.
Due to COVID, it's 1%, 367 out of 27,729 cases. And that, if you put like intensive care, it goes down to 24, so. This is ever hospitalized, you know, like if you had to spend, you know, go to the hospital, basically.
And there's substantial literature, I'm looking at an article here, why is COVID-19 less severe in children? I mean, there's substantial peer-reviewed literature as to why, at least theories and hypotheses as to why that is the case. I mean, so I think those things speak to the lack of severity. And our own data speaks to the case of limited frequency. Any additional questions, comments? Thoughts? Because there's an administrative recommendation before us, our agenda would have us taking up action. Administration, I'm assuming, would like us to take action.
We'd like to be able to tell our families as we head into registration, this is the plan for next school year, so that if someone is saying, I want to fill out a homebound form, that they aren't, you know, that they're able to have time to be able to do that, and let people make informed choices for the next school year. And others who would say, we received emails from others saying, if my kid's required to wear a mask, then they won't be going to your school system, I'll be homeschooling them. It's both ways, unfortunately.
And just before we move to that point, I do, our district policy or school board policy 8420.01, epidemics and pandemics, it gives the superintendent the latitude to define those upper and lower limits upon which an action may be taken either at a building level, a class level, a grade level, what have you, in the interest of time and situational appropriateness to take action relative to elements of this pandemic. That is part of our board policy.
And the discussion we had last year when we had that same discussion was that if it was district-wide, that we would bring the board together to have that discussion. But that was part of the policy limits as well.
Okay, then I would entertain a motion to adopt the administrative recommendation as presented.
So moved.
Second.
Okay, a motion has been made and seconded. Is there any discussion?
I just want to say that we've heard people speak and all the emails that we received about the elementary schools in particular. Personally, I feel that I would be a bit concerned, given that having the different variants out there. I would like to see, even though it's low in our county right now, I still feel that because the elementary school kids haven't had the opportunity to get the vaccines, I would rather see them be protected at some level by wearing masks. Just so, I mean, that's one thing we know that does work, is that level. So I would like to see that for our elementary school level. I mean, it's something that's simple and effective, and it could protect our youngest students.
I just would add, to clarify, there are a lot of things we're doing to protect those kids, and besides masks last year, I feel like all the attention, everything the district did, there's no way to break it down, but it sure seems like the only thing that mattered was masks. It wasn't the filter, it wasn't the cleaning, it wasn't the social distancing. It's like, once you take away the mandate to wear a mask, it's like, well, I'd like to see something done to protect them. Well, there's a lot being done. Without any evidence to suggest that it was only the mask is the thing that wouldn't be based on science. I would also say, it's my feeling that to suggest there's evidence that masks on a 4-year-old is the reason they're not dying from COVID is also not based on science.
Well, I'm not saying that we
Or any
didn't do,
young
right,
child.
I'm not saying we didn't do other things. We did. I mean, with the air filters and cleaning, but I'm just saying, what we do know is that we didn't have a spread, and we took precautions.
And we're still taking.
Right.
Any further discussion?
So would we then go forward with the cohorting for the elementary? And that was one thing that.
Yeah, I'd be interested to hear if the board would like to make modifications to the plan. I mean, I'm not sure that, I don't know if that's what's on the table, as you're saying the entire plan, or because I've heard some modifications that you've discussed that you may, I don't know, but I don't know if the majority of the board wants those modifications.
That's what I'm trying to ferret out.
So, okay, because I'm trying to ferret that out as well. Because I want to make sure we're implementing what the board wants us to
Right.
implement.
No,
So I think
you're right.
you've brought up a certain part of it, and is the majority of the board, I don't know. I'll leave that up to you, Mr.
I'm of the
Larkin.
opinion that maybe Paul's, that maybe it is that you only have to do it for, until, the homebound until you have a note stating that you've changed, your homebound situation has changed. In other words, like, you can be homebound until, honestly, probably till you get the vaccine, which is your choice. I mean, I assume if you're homebound, you're waiting, most of the people are waiting until their child can be vaccinated, is the reason that they're choosing to stay home at this point.
Just on that, I would think that we would probably want to go, if we were going to make a change, do it at semester, that it's a clear point, versus it being on a random Tuesday or something like that, and teachers have people coming in and out that you would notice.
But would you adopt then if it happens that it gets delayed and it's going to be February, I'm not.
Then I think what we did last year, it was semester, and then we relooked at it and we went to end of third quarter. I think there would have to be some.
That's what we said
To
the
be
semester
fair.
last time, because we'd said, so we didn't do the quarter, because it was like, what's gonna change between, one quarter to the next? I mean, because there were just so many unknowns, and we knew there was gonna be a vaccine. So, you
I
have
have
an issue, yeah.
Concerns about the cohorting, just from the academic concerns. I understand how it's a helpful method. I also understand that how many of the kids, though, did have struggles, because you cannot group kids according to ability then, because if it happens, I get placed in Mrs. A's room and you're in Miss B's room. But truthfully, we would be really well paired up for, like, we're at the same level and we can work on that in our intervention. And we can't because you're in A and I'm in B. That does concern me. And I know just from our, looking at results and stuff and struggles that every school district is facing from last year, that it does concern me with the cohorting. It does affect other things, as you cohort, socialization, like it happens that, we all get it and you make new friends, but the fact that you cannot even be near that person who got placed in Miss B's room because of the fact they're not in your cohort is very challenging, especially at all levels.
And that would be lunch,
Lunch,
everything,
yeah.
locker, bus, everything we did last year, right? I mean,
We did, at the high school, I would strongly be against it. I mean, when you're a junior, and you can't sit, like my friend has to sit X far away. What?
Like, all the discussion is more on those.
But
who
even
aren't
in elementary
vaccinated.
school, those kids,
It's
friendships
tough,
do mean
yeah.
stuff, and So does their health, but they all made the choice, they had the consequence this year, and we were very happy how it turned out, but I'm just not sure I want to put those kids through it, because that is harder to, at what point do you say it's semester, we'll reevaluate, whether or not you can intermingle with the class, with the other class. It does really decrease your interaction and the number of students, because you may only have 20 kids then that you have interaction with. And if it happens, you don't have a good fit, which sometimes happens.
Right.
You don't have that
Yeah, it was,
option.
when we allowed classes to come together for recess, that was a big bonus for some kids. That really made because they were missing their friends. They just were unfortunate that their friends weren't with them, and that was their chance to connect. And so at the elementary level, I know that was a big piece of it. I mean, there's opportunities we could try and limit various pieces of cohorting. So if it's at the grade level instead of multiple grade levels, there are things that we could do that would help with that at the elementary level. You're not able to do that at the high school level, obviously, because you're going to have the mixing of students based on the classes that they choose. But that may be something that we could look at. K-8 that would go with that, for K through 8.
I mean, we would be adding the cohorting while still having the homebound option. So,
Right.
It doesn't sound like my guess is the homebound option is gonna be what people choose versus saying, I'll send my kids without masks.
Because of cohorting.
Right.
Yeah.
That doesn't,
No, that's a
my
good
guess is that's not gonna assuage their concerns. So then we'd be doing it for the people that were willing to send their kids, to school, which my guess would be that they would be fine without it. So.
Yeah, and we'd be watching. I mean, that's the thing of, we would know where these students are at. And so although we aren't mandatory quarantining, we would understand the situations that they've been in and how that's impacting if other cases arise. Because, I would love to see a case study of, someone with our MERV 13 filters, our bipolar ionization system, and no masks versus someone without those things and masks.
Yeah.
I mean, it's hard to determine what percentage was all of those things. I think that'd be a great case study just for moving into the future, because it is hard to say, well, was it this, was it cohorting, was it eating lunch in the classrooms? I mean, the things that teachers hated and that, was hard in the classroom and kids hated and, all those pieces, but you tried all these things, and then eventually we moved into other pieces. But we would say there are other districts that held firmer to stricter guidelines than what we did, and they ended up having to close more. And so it isn't as, and they were wearing masks,
Right.
So there's other variables. But was it that their community didn't buy into, my kid doesn't feel well, so I'm going to keep him or her home sick, because then that didn't bring COVID case in, which then you didn't have self-quarantining, all those pieces that sort of, because our community, I think, was really great about that. And there's a lot of parent buy-in. And so maybe not so much at the beginning when we struggled, but as it went along, it became really good. So there's a lot of factors that go in it, but we would know the mitigating factors that we had last year that resulted in the results that we had. And then we would know the mitigating factors that we aren't utilizing, and if something changes, then we would be able to quickly implement those strategies.
So cohorting,
Well, I'm keeping a scorecard here, so.
I think I was the one that asked about cohorting, and I don't think, and I'm not even saying that.
Well, before we go there, any
Good idea. I just
additional
was asking.
thoughts or considerations for administration? Okay, then the three things that came up are masks for elementary school, homebound exception at the time of or for vaccination availability at the elementary school level, up to and including 6th grade. And then the third is normalization of cohorting consistent with pre-pandemic practices.
Pre-pandemic.
Right? I mean, that's what, so those are the three things that we just talked about here. And we've got a motion on the table to adopt the administrative recommendation as it's been presented. We have a second. I'm not sensing, or is there a sense for masks at the elementary level beyond the optional as presented?
I would like it.
Yes.
Yes, that's fine for
I'm
me.
looking around to the other board members as to their consideration. Because at the end of the day, I'm going to ask if, for each one of these, I'm going to ask for some thought if there is no appetite for moving in that direction, but there is appetite moving into one of these directions, and I'm going to ask for the original motion to be withdrawn, and then a new motion made with an amendment or a change to the administrative recommendation. So that's why I kept score of these three things, and so I'm getting the sense that there's not a great deal of appetite for masks beyond what the policy says right now. Nodding of the heads, yes? Okay. Homebound exception associated with vaccination availability. Is that something that
Yes, I am in favor of having the
I
exception.
would be interested, I would be in favor of something like that?
So a family, 6th grade and under, does homebound, vaccines come out, they get the vaccination.
But we
then
would have a
they can
date, as Steve said, I'm with Steve on
Right.
like, we would have
Semester.
a semester.
Yes.
I'd go with the semester. I'd be in favor of the semester.
Semester or,
Okay, so it seems like there's some interest in that. Cohorting similar to, normalized cohorting similar to modifying the administrative recommendation right now, which is to returning to cohorting in a pre-pandemic fashion. Is there interest in
No
exploring?
cohorting is what you mean.
Yes, we're going to, well,
We're going back.
we're going back to pre-pandemic
Yes,
So you can,
state.
Right,
yes.
that's what I'm.
Okay, then, in light of the fact that we have at least one consideration for change, I'd ask Jerry if he'd withdraw his motion,
Yep.
and Carrie if she would withdraw her
my
second. Okay, then I'd entertain a motion to adopt the administrative recommendation, subject to a change associated with the homebound exception for vaccination availability, 6th grade and down, relative to a date certain. Relative to some date.
So,
Second.
so are we able, some discussion? All right.
Yes.
What,
clarify too.
when we say that, well, basically, you can kind of rescind the homebound directive and then send your kid back at the start of the second semester. But is that from a legal standpoint, are we able to base it on the vaccination? Because it's not like,
That question I don't know.
because the vaccination is not required. So,
No, and I guess my position, Jerry, would be that we would give families an option. Right now, the way the administrative recommendation is drafted, if you choose to apply for a homebound exception, you are virtual for the entire year, right?
Correct. And there's a piece for the doctor's recommendation for that. That's correct.
And my position would be, you would have an opportunity to rescind that application, subject to the availability of a vaccine.
and that's where I'm going.
Yes.
Why, do we have the right to say, or is it legal to say you can rescind it based on the availability of the vaccination?
I like better your.
Why do
description
I
that
need that to
A
make it?
doctor, if you need a doctor's note to get the homebound, you need a doctor's note saying that they're released. We feel you're now able to go to, you are able to go to school safely.
Right,
There has been a change.
that's different though, right?
Yeah,
I mean,
and
we're
I'm
specifically
not saying, you know,
saying,
at
Change
the
may not be the
semester,
vaccine.
whatever change, if your doctor says you believe there's been a change,
'Cause
or
some-
Okay.
the doctor
because
believes
somebody
there's
could
been a
want a
change.
homebound exception for the year that isn't related to the vaccine, right?
Correct.
I mean,
Correct.
this isn't a new thing, we've had this, so
It's not related
they
to
don't get
vaccine.
the option to
Right.
rescind it at the semester because it's not based on the vaccine? That doesn't seem right to me. They
Okay.
should be able to rescind it whenever they want, based on that, or, you know, whatever they want, or the ultimate layer of protection that we, you know, whatever they say is their reasoning to want to open-ended, not just specific to people.
I agree with that. Is that sufficient guidance for you to pick that element up from a
As long as Kara's.
opening perspective?
We do, yes.
Okay.
Yep, yep, we can communicate that to our parents.
All right. Any further discussion? We've got a motion on the table. It's been seconded. All those in favor of the motion, aye? Aye. Opposed?
I oppose.
And it passes. All right. Thank you, everyone. Thank you for your time. Thanks administration, most importantly, for the time and effort that they put in to developing these plans consistent with what they believe to be in the best interest of our students. Okay, then we will move on to public comment. This is in normal and general public comment. Is there anyone here this evening regarding public comment? I see that there is. Okay.
I'm going to sit down. I was in the hospital earlier this morning, and I have a big, loud teacher voice, so you will hear me. Kathleen Dart. My address is 1003 9th Avenue here in Grafton. So first off, I want to introduce myself. My name is Kathleen Dart. I'm a parent of 2 children in Grafton School District. I'm also a special education teacher as well as a licensed general education teacher. I've taught at all levels of education and have taught students at a therapeutic day school who've had intensive emotional regulation issues. I have taught in a resource room where I pull children out and work with general ed teachers as a team teacher. And currently I serve as a high school ID teacher and the transition teacher at my current position. So with that being said, I have made many, many connections. I have worked with several different methods of instruction and sometimes focus strictly on behavioral support depending on the student's needs. My job is always changing, and I am constantly learning new methods and reaching out for support when I need it. The person addressing you currently loves this field, and I'm so privileged to work with amazing students who have changed the way that I see how people learn. Now I'm going to address the reason that I am speaking tonight. First off, I would like to start off with a quote by Liz Foslin, and I hope that's how you say her last name. Diversity is having a seat at the table. Inclusion is having a voice. And belonging is that voice being heard. I'm going to read it one more time because if you're like me, you got to hear it twice. Diversity is having a seat at the table. Inclusion is having a voice. And belonging is having that voice being heard. Both of my children are neurodiverse, meaning that they learn in many different ways, sometimes that are not traditional. I'm also neurodiverse, very proud of it. Learning in a traditional classroom environment presents challenges and obstacles that the neurotypical students, I think in Grafton it is 76% or 86, I think it's 86% is general education. So there are many amazing educators here and intervention services for the general education public. My oldest daughter has been very fortunate to receive these supports and services in addition to emotional support as well and being heard. And I cannot thank the educators and the staff that have worked with her enough for that. My youngest daughter is a bit of a different educational path since she's been attending Grafton since the age of 3 to receive specialized education for her intellectual disability. She has an IEP, which is an individualized education plan. Individualized education plan. This plan specifically outlines where my daughter is academically, socially, and emotionally, 3 elements of important learning that take place at school. She has goals that she is working towards, not necessarily grades. She has accommodations and modifications that are put into place to support her very diverse way of learning. Diverse is not wrong, it is different. She needs these, and they have been done And they have to be done consistently and to fidelity to ensure the growth, her growth and gaining new skills, just like any other educator would do in a traditional format. Free, appropriate public education she is entitled to, and her skills need to be met for her future beyond school, not necessarily college, like the rest of the general ed population or trade school, etc., jobs. So here's where things get kind of cloudy. When an IEP team meets, they meet with the family and the student, very important. I think that's kind of forgotten about in a Mass General, but with the student. It is a collaborative effort, period, end. Collaborative. Parents have input, and this is even a part of the IEP. Parents' concerns. It's right under present levels. Students' needs change throughout the year. Staffing can shift, questions and roadblocks pop up. I just wanted to let anybody know who is listening that their student has a right to an IEP or a reevaluation at any time. If they have questions, the team can meet with the parent. It can be formal, it can be informal, and it needs to be met to the parent's availability. Most parents work, most parents have other things that they are doing, and a lot of special ed parents are caregivers. So, with that being said, it is not for the school to tell the parents what the IEP is going to be. The parent is not going to be sat down and said, this is how it is. They can be said, here is our data, here's all the information we have collected at our institution. That is, I would probably say 50% of my job is collecting data, meeting with the students, meeting with the families, and figuring out what's the best for them. And guess what? I had an IEP change like 4 different times on me one year, and that's okay. That's what it's supposed to do. So here's where things get kind of muddy. What happened with my youngest, I had concerns, brought it up before the meeting, brought it up during the meeting. Both times I was told, that's not really how we do things, or that's how she's not at school. She's not like that at school. She's fine. She's fine. My daughter verbally said she was not fine. She said that she had a couple of different things in her way. She verbalized it. I saw also behavioral changes, which is something that I know as a special educator and as a parent. When I noted her present levels in the IEP team to say, hey, in your present levels that you wrote, this is what you're saying her skill set is. And specifically, I'm talking about social skills and making friends. And they said, oh, it'll work itself out. All I wanted was social skills so my daughter could connect with peers. Not hard. When I asked about how evaluations were done in her general education classroom, I was told, oh, they're verbal. Again, her ability levels in language, auditory language, are not a strength. And so why are they testing her this way? And then when I questioned the teacher, the special education teacher, and the IEP team, they said, oh, well, she gets it. She just nods and says yes. Well, it's called echolalia. She'll repeat whatever you want her to say because she wants to be friendly. So, again, I addressed her present levels. You wrote this, you evaluated her on this. So, nothing really happened. I had to leave that meeting early due to a situation that arose in my classroom. And so, I reached out to people again, and then I finally had to go to the superintendent to get things changed. And once that happened, things miraculously changed. All of a sudden, I was worked with. So here's my problem. Yes, diversity was happening for my daughter. She was asked to sit at the table. But at that point, until I spoke up, she had no voice. So it was not inclusion. I advocated for my daughter 2 more times. Got it. Perfect. It was collaborated on. We worked with everything, and it ended well, and I'm so grateful for that. And thank you for everybody who worked with me and my family, as well as for my daughter, to get that done. While those were being addressed and worked on, sadly, that's not the same for other families, and that's why I'm asking for your thoughts and support tonight. Families are scared, they're worried, and they're exhausted in fighting for free, appropriate education for their students, something they are legally obligated to get. Meeting after meeting, and steps are created, but there's really no follow-through. This has been an issue for a family for 3 years. These are families that I have the pleasure of knowing. Oh. Oh.
I've allowed you to go on as it relates to your own daughter because you're free to share that information, but as it relates to other families, and as you referenced in your opening comments, the nature and extent of an IEP meeting is between that family and the family's team, or the student's team. So I'm just going to ask that you respectfully keep your comments limited to your own personal experiences and not what the experience of the other families may be, or what you perceive those experiences to be. If you can, please.
So, when parents, let me try and take that element out of my writing. So when parents work with their children who have multiple needs, they meet with outside therapies, schools, Center for Learning, so on. I mean, it's endless. They have gone to expert after expert. They have listened to what their child's limitations are and how to help them. Their child's entire life most of the time. Parents are a part of the IEP team, and so are the students. They have a right to be heard. Children are entitled to an education that fits their needs, not necessarily to what their peers are doing. While working in this field and attending many courses, I have talked with different educators and administration about special education and what it truly means to do it right. It's a part of learning and growing as an educator. Here's a fact you may want to know. I took a class on inclusion and appropriate education for students, and we were told what not to do, and the specific sample they cited was a case here in Grafton, and it wasn't appropriate education, and that's just what we were told not to do, and they cited it as a source. I have sat on collaboration boards, and again, Grafton's name was mentioned as kind of being a mess for special education students, and this is professionals meeting together. So, this is the only district that they spoke of, and they did not know I was a resident or a parent or had a child in the special education program. But I agree with them. When I started hearing these comments is when I had already raised concerns. It's not just the parents that are complaining and wanting these lofty goals and unreasonable things for their children. And I know sometimes we come off as passionate or we become emotional. These are our children. We are going to be caring for them for the rest of our life. 5 different people at 5 different meetings or boards brought this up. 5 different professionals of different varying special education. And now I'm making it 6. You're hearing my voice. There are many things that are done right here in Grafton, but the climate for inclusion and the voice of the students in special education and their needs are not getting met, and neither are their families who are having to jump through hoops for change. Now I would like to revisit the quote. Diversity is having a seat at the table, inclusion is having a voice, and belonging is that voice being heard. As a parent, teacher, and advocate and human, I am asking you to extend that to myself, my child, and other families in special education, that you not only serve just diversity, where they're invited to the table, but true inclusion and those children and families' voices being heard. Thank you for letting me talk and letting me have a voice. Now I'm asking you to listen.
Thank you.
My name's Andrew Burns, 1211 Dolly Lane.
Could you use the microphone, please?
And I'm going to sit down. You're all right.
I'm going to move the microphone.
All right, go
closer,
ahead.
because I'm having a hard time. If you could, great. Do you need help lowering it?
Yeah, I'll get it. Just a comment. Is there a board policy where we can't speak about other families if we don't name them? So the answer is probably no. And I have to, Paul, and I'll be honest with you, I'm really upset about what you told the last lady.
Hang on just one second.
Go ahead.
Is there a board policy that prevents you from speaking about other families?
Yeah, we're not naming other families. We can speak in generalized terms, and I think that's acceptable.
I think what's acceptable is that if you're here, you speak to your experiences, not to the experience of others.
Yeah, I have to disagree with you, Paul.
But that's, and you can disagree. I'm just going to ask you to keep your comments relative to your experiences and not to others, especially in light of the particular circumstances here that are in fact covered by individual education
Yeah,
programs.
well, I'm going to speak in general terms, so I'm sorry.
Well, I will, if those general terms begin to delve into what other families may be experiencing beyond your own, I'm going to ask you to stop.
Well, isn't this public comment?
It is public comments, but public comments reserve the right for me to do as I just said.
Is there a policy that states that?
Yes, in fact, there is a
Well,
policy
can you
that
quote it
states
for
that.
me?
The actual policy?
Yeah, I'd like to hear it.
The policy itself.
Yeah,
is,
just tell me.
Policy 167.3.
Okay, and can you read it exactly what it says?
Participants shall address only topics within the legitimate jurisdiction of the board. The board itself has no legitimate jurisdiction over an individual education an IEP relative to an individual student. And in fact, we are advised that we are not to talk about those particular matters as they relate to an individual student. So that's one item.
I understand it, but can I just make a comment? You have general counsel here?
We don't have general counsel here, not that I'm
All right,
aware of,
well,
no.
I haven't brought up any IEPs. I think the lady before me was talking in general terms of what the parents of special education children have been experiencing.
And I respect that and I understand that. I just respectfully ask that you keep your comments and your questions centered on your experiences and not the experiences of others.
Yeah, well, Paul, I have to disagree with you on that because it's an aggregate experience. If you don't hear it or see it, with all the evidence we sent you guys, there's a theme going on. And if you don't like it or not, that's the fact. And we'd like to get it addressed. And so that's what we're here. We're trying to speak up about it. And we'd like to get answers to our
But unfortunately,
questions.
at this point, the only way to address it is through the individual IEP.
Yeah, well, we're all, yes.
Okay, so I'm just
We
going to
will pursue that. Just
respectfully
hold on
again
for a
ask
second.
that you.
I'm sorry.
you-
Just hold on
you
for a second,
Keep your
please.
comments
I understand what you
limited
said.
to your own personal.
Paul,
your
I understand
personal
what you
reasons.
said. Just let me
Okay?
finish.
All right.
Thank you. What I've asked Jeff and Laura, and hopefully I'm going to invite the board, I've hired Maura Kelly. She's from the WEMSP. Laura, you might know the name of it. I hired her as a private mediator so we can at least have a dialogue with the board members, administration, to get something going so we can answer our questions from an aggregate perspective because we're not getting any action on an individual level. So would you be available to meet as a board or people who are who would have an interest in doing that? I'm asking you publicly. It's going to be a yes or no.
I would have to confer with counsel as to whether or not that is an advisable situation.
Yeah, what we're doing here, Paul, is we're trying to get the stakeholders all together and have a positive direction going forward. We just want to have a conversation with people in leadership so we can get things accomplished. Jesus, it's an IQ test. It's a yes question. The answer is going to be yes.
From administration's perspective, that any family that's requested a meeting, we've held a timely
Yes,
meeting with them.
I know.
And had conversations with them, and I don't think anyone here would disagree with that.
Right.
That we've had, when meetings have been requested, we've had timely meetings with families so that,
Jeff, I
so
have
that
to
we can move in the
disagree.
right direction.
I have to I totally disagree with you, and I respect
Andrew,
you as
we're
a
not going to
person.
engage in a debate. I will afford you a few more minutes for your public comments. This is a regularly scheduled meeting of the Board of Education. It's a working meeting. We have a long
I
agenda.
agree,
And I'm
and
not
I'm-
dismissing your circumstances, your situations. Superintendent Nels has indicated that to the extent that you would like to meet to discuss these matters, he's available to meet. To the extent that these matters, which are not necessarily a matter of board policy, I mean, I can't speak off the top of my head. I quoted the board policy, the section of the board policy that you asked me to recite. You asked a specific question, I gave you a specific answer. I cannot answer that question tonight without further investigation and consultation.
All right.
So if you have additional comments, I'm happy to hear them.
Okay, good.
Okay.
I'm sorry. It's just,
All right.
it's a tough situation.
Yeah, I appreciate that. And I, just so we are clear, this board and this administration wants nothing but the best for all of the students in this district.
That's great. That's all
Okay.
we're asking for from
Right.
the coalition of family members. You just want to get into a real dialogue and a discussion
Right, and-
for
and-
positive solutions.
Yes,
We're
and-
asking for people to come together. We don't want to be separated and dominated. We want to work together with the board. We want to work together with administration. That's all we're asking. If that's too difficult, I get it. Just say no.
I don't want to say no.
Okay, good.
I
Can I
want
ask you
to
this?
I answered the question already. I'd ask that you please move on with the
Yeah,
comments
I
you
understand
have.
what you said.
Okay.
So when can you get back to me when you speak, after you speak to general counsel?
I don't know that person's schedule, so I will have to get back to you.
Okay. Can you get back to me within a couple days, you think?
I don't know the answer to that question. I will do it as quickly as my schedule allows and their availability dictates.
Okay. Is general, oh, forget it. Anyway, the invite goes out. I'd like to have you guys all involved and get towards a positive solution, because the evidence has been, there's a theme going on that the special education, you can talk to the family members, you want dialogue, we have it. We want to have it. We're not asking for money. We're asking to get positive solutions that we'll pay for. It's no resources out of anybody's pocket. All right? So we like to have those dialogues. We want to have them very soon. That's all we're asking. It feels like we've been dragged through the mud for 18 months. 19 months are going on. And if you're in our position, you would feel frustrated. You really would. And if you don't feel that, well, then you guys should rotate off. Yeah, that's all I'm going to say tonight. So thanks for your time.
All right, thank you. Any additional comments for this evening? If not, then let's move on to item D. The Finance Committee met on July 12th. Mark, you have a report from the Finance Committee.
Yes, Finance met on Monday, July 12th. We had a few agenda items. One was, actually, we had the honor of having Mike Clark from Baird join us, and we discussed in at length a option to, or an opportunity to reduce the referendum debt with some varying ways of doing that we agreed that are worth Baird to look into. It would help both reduce our debt and loss of financial or state aid. So there are some things that Mike is going to take back and look at and bring back to finance. After researching them further, we're kind of in a unique spot with the referendum. So that was one of the items. The other was the 20-year capital maintenance plan, which we annually review, which we did at that meeting. And after reviewing that with some changes, I think the one thing that came out of that was administration trying to highlight those changes so that they're a little more obvious to members looking at them. So that's about the only thing, but we did review that, look at that in detail, which is a good thing to do and be prepared for. And so that was recommended to the full board, which we will be talking about later. One of the other parts of that came out of that was an additional transfer to Fund 46, which is one of those mechanisms to fund the 20-year capital maintenance plan. A little tweak from what was discussed at Finance from what I saw on the agenda tonight, with a little bit bigger contribution to Fund 46, but in any case, that was talked about. And then the last item was the good spot to be at with the referendum and closing that out and all the associated projects, both managed by Hoffman and us internally, which had some cost savings. So we will be hearing about that later too.
Any questions for Mark? Thank you, Mark. Let's move on to item E, the personnel report.
Yes, we have some personnel approvals that we would ask for both hires and then for resignations, and then some informational pieces. So for approvals for our new hires, we have Lindsay Borner, instructional coach at Kennedy Elementary School, Joseph Brown, instrumental music teacher at Grafton High School, Ann Helmbrook, music teacher at Kennedy Elementary School, Cynthia McWan, special education teacher, Grafton High School, and David Schrader, a math teacher at John Long Middle School. And then resignations, we would ask for approval for Jennifer Deering, instructional coach at Woodview Elementary School, Caitlin Moon, math interventionist, Woodview Elementary School, and Katie Ruff, special education teacher at Grafton High School. Informational pieces, we have new hires, Rebecca Bailing, custodian at John Long Middle School, Billy Foster, custodian at Grafton High School, Amy Janata, special education aide at Kennedy Elementary School, and Nicole Smemby, kindergarten aide at Kennedy Elementary School, with the resignation of Maria Martinez, special education aide at John Long Middle School, and Deirdre Muhlenberg, custodian at Woodview Elementary School.
Okay, so let's take these in pieces, starting with the new hires. So I would entertain a motion to approve the new hires as presented.
So moved.
Is there any discussion regarding those new hires? All right, all those in favor of the motion, aye? Aye. Opposed, and it passes. Then we'll move on to the three resignations. Jen Deering, instructional coach at Woodview Elementary School, Caitlin Moon, math interventionist at Woodview Elementary School, and Katie Ruff, special education teacher at Grafton High School. We have a motion to accept those resignations. Is there any further discussion regarding those resignations? All those in favor of the motion, aye? Aye. Opposed, and that passes. And the rest are for informational purposes only, so I think you have what you need there. All right. Item F, academic standards.
Sorry, wasn't a musician. So each July, the board, state statute has the teaching and learning department bring forth a set of standards that we use here in Grafton. These standards haven't changed. In my transitional work with Diana, I really talked through these standards on what it means here in Grafton. But I wanted to touch briefly on the second part of our professional learning communities and what that means. And the most important question we start each of our curriculum cycles with, each one of our 100-day plan cycles with, is what do we want all students to know and be able to do? It's an extremely broad question, and without standards guiding our way and guiding the direction in what we do, we really have nowhere to go. So these standards that we've listed below, with Wisconsin academic standards, the Common Core state standards, the disciplinary literacy standards, next generation science standards, ACT college and career readiness standards, national standards for health and art, the WEMA Wisconsin music standards, and the national sexuality education standards are what guides that process. One thing that might jump out at you as we followed up from our board retreat is the college and career readiness standards, which helps to guide our dashboard. We have these discussions on these standards to help guide also the next question that we come to on how will we know if they learn it. So now as we see that autopsy data, if you will, through ACT, through Forward, we can start to drill into the standards and determine what are essential standards here in Grafton. You've heard us talk about standards-based teaching and learning over the last few years and what essential standards and what we want students in Grafton to be a college and career readiness graduate and what standards are essential. So I'm seeking board approval on these academic standards for the 2021-2022 school year.
As prescribed by the relevant sections cited in the resolution, I'd entertain a motion to adopt these standards as the standards for instruction in the District of Grafton Schools.
So moved.
Any discussion? All those in favor of the motion, aye? Aye. Opposed? And it passes. Thanks, Michael. DPI Special Education Model Forms and Policies and Procedures.
Okay, Board Policy 2460, the Programs for Students with Disabilities, directs you as a board to annually adopt the Wisconsin DPI Model Forms, Policies, and Procedures Manual as the official policy and practices of our Grafton School District. These are the processes and procedures that we use on a daily basis when we evaluate students, write IEPs, and implement the services that are in the IEPs. There have been literally no changes to this policy since 2018. The forms themselves have been updated just a little bit this year, but aside from that, this is something that the board just needs to do on an annual basis. And really, there haven't been many updates to the policy. There have been no updates at all to the policy. It's the forms themselves that have changed a little bit.
So I would entertain a motion to adopt the Wisconsin Department of Public Instruction Special Education Model Forms and Policies and Procedure Manual as the special education manual for this Grafton School District.
So moved.
Second.
Any discussion? How do we stay on top of changes in the forms and the policies and procedures as promulgated by DPI?
So when DPI rolls out the new forms, they roll it out to all their vendors, and in our case, it would be Skyward. So then on an annual basis, we update and we just upload the new forms.
In procedures that may be pertinent to the elements around the forms?
So DPI informs us, and there's trainings that sometimes go on, and then we, relay that information onto the teachers during special ed meetings. If situations arise that are really specific, we will talk about them on an individual basis. But again, like I said, none of these have changed since 2018.
None of the forms or the
The policy and the procedures themselves.
Okay. Okay. Any additional questions? All right, all those in favor of the motion, aye? Aye. Opposed? And that passes. Thank you, Laura. Summer teacher vacancies.
Yes, as we have vacancies we're currently hiring for, some of these resignations that we had. So vacancies that are open or that may open between now and the beginning of the school year, in order for us to fill those vacancies as quickly as possible, I'm asking the board to authorize administration to offer a contract. People are not going, if they have a position somewhere else, they're not going to withdraw from that position before they have a contract. As I mentioned earlier, we don't meet as a board again until after we've had all of our orientations. And so we are asking administration to extend pre-approved teacher contracts to top candidates in order to fill vacancies that occur now beginning of the 21-22 school year, and then contracts will still be presented at the board at the next regularly scheduled meeting. So we'd still follow the background that we typically give you and so forth, but we're asking for pre-authorization of contracts.
This isn't new. This is something
Correct.
that we have done in the past, and
It is helpful to administration and for our students to have a teacher in front of them before the year begins, and for them to be able to get into earned service, learn our practices and procedures in order to be successful. One of them being a special ed teacher that we're trying to get in now for a final interview. So like those are the pieces that we need to be able to do to move forward as quickly as possible.
all right, so I'd entertain a motion to adopt the administrative recommendation as presented.
So moved.
Second.
Any discussion?
This doesn't take away any board duties or responsibilities, right?
No, we are still obligated to approve contracts. If we were not to approve a contract, I mean, there could be a reason why we would not after you've gone and made an interim, right? In my 20 years, it hasn't
Anything's
happened.
possible. It hasn't happened yet in my 6 years, but.
But no, the answer to your question is no.
Right.
It does not preclude
Yeah,
us from,
but no, that's why we'd still bring it to you at the next regularly scheduled board meeting, so you would be aware of that.
Right.
Nothing is the board is the only one that can hire. We can recommend positions and terminations with the board is the final piece of that.
okay. Do we have a motion? Yes, we do. All those in favor of the motion, aye? Aye. Opposed, and it passes. 2021-22 instructional aid compensation.
Yes, so the next couple items are for compensation increases. First up, we have instructional aides. We break it up with instructional aides and support staff so that the board may more fully participate in approving these compensation changes. So with instructional aides, which include 4K and 5K aides, special ed paraprofessionals, as well as library aides at the elementary level, we're recommending a 2% increase for the 2021-22 fiscal year. This is currently included in the preliminary budget that was approved at the June board meeting. Any questions on that recommendation?
No, not hearing any. Then I'd entertain a motion to approve the administrative recommendation regarding instructional aid compensation for 2021-2022.
So
All right. Any further discussion? All those in favor of the motion, aye. Aye. Opposed? And I abstain.
Next up is the support staff compensation piece, which includes office staff, tech support staff, maintenance staff, as well as at the 612 level, library aides, and at the high school level, study hall aides. And so we are recommending a 2% increase to that employee group. Again, that is included in the preliminary budget that was approved in June, and administration is recommending that 2% increase, and so we look for a motion for that.
Any discussion? Hearing none, all those in favor of the motion, aye. Aye. Opposed? And it passes. 20-year capital maintenance plan and Fund 46 transfer.
May I have-
Oh, thank you. Yes, you may.
All right, so we discussed this at Finance Committee, as was mentioned earlier. So we reviewed a number of pieces. You mentioned the color coding for one. So if you follow the link into the plan that was shared, you'll see highlighted blue some of those new additions in the piece. So this past year, we completed the following projects at various schools at a cost of about $150,000. So with looking at what we accomplished this past year, looking at some of the primarily one-time budget pieces that came in, where we have additional funds that we could transfer to Fund 46, and primarily related to COVID. So you've got ESSER 2 revenue that came in that we didn't know about when we finalized the budget in October. Fund 10 Medicaid for prior year reimbursements. Those two pieces were nearly $200,000 or $300,000. We also had a significant results in terms of our subbing costs coming in below what had been budgeted due to staff being able to teach from home. Summer school, that was from last summer, had far lower participation, so those expenditures were certainly lower than what we had budgeted, as well as transportation costs, among others. What we're recommending is that we transfer an additional $150,000 to cover those completed costs from this just past year. Also, to transfer $210,000. That would be the standard annual contribution that we did not budget for in 2020, 2021. That was part of the flexibility piece so that we could afford to operate our schools during COVID with a balanced budget. We also have identified some recent projects. We'd be looking at an additional transfer of $123,000, namely to upgrade the high school auditorium restrooms to match existing restrooms, the Grafton High School locker room egress that is necessary due to some of the work that was done during the referendum, the Kennedy shed that needs to have siding put on it, the GHS Fab Lab remodel also at the high school. We've also identified some pieces totaling about $29,000. We discussed the business ed classroom furniture piece. I think I may have identified it as LMC furniture. It is to stock or to create a business ed lab, if you will, classroom furniture update at the high school. This is using funds that come from the high school budget. Okay, so at the end of the year, we take a look at our budgets across different departments, across different schools, and make a determination if there are funds available to spend on certain priorities. In this case, this was a priority at the high school, but we're not going to be able to get the furniture in by June 30th. In the past, before we had Fund 46, we didn't have the option to transfer money into an account and book it to the prior year. So we have until the end of July to put money into Fund 46, right? That's booked into the prior year, and then we spend the money when we have those projects completed, or we have those items in. So we have the business education classroom furniture at $25,000 that we couldn't get in by June 30th. So we're looking to transfer the money to 46, pay for it when it comes in. The same is true at John Long Middle School. We had put in an order for tech ed equipment using money that was available in the John Long Middle School budget. Those pieces of equipment have not come in yet. So we're looking to transfer those funds that would have been expended if the furniture came in by June 30th, transfer it into Fund 46 so that we can make that payment in this new year out of Fund 46, but book that cost into last year's budget. This would be a total additional transfer of over $500,000. Doing this would certainly make our capital maintenance plan healthier. So we'd be fully funded through 2029, 2030. There would be a shortfall of over $1.3 million in 2034-35. In order to pay for those scheduled expenditures, we would need an average of $97,000 per year in either increased revenue or decreased expenditures. We've averaged about $214,000 of either increased revenues or reduced expenditures in the years 2016-17 through 2019-20. We monitor that over time to make sure that our past history would allow us to meet those scheduled expenditures. Also, with this transfer, we would have the option, we discussed the potential refinancing of our debt into bigger payments in fewer years. We would have the ability to couple our transfers into 46 with our Fund 39 debt payments, which would have the ability to lower our shared cost, eliminate the negative aid on these transfers, and lower our debt levy by doing this. Any questions?
So whatever it was, the 29-ish thousand, I mean, this is where Fund 46 is beautiful because we can incur those expenses even though they're not here. And those were the items that we didn't talk about, I think, at
Correct.
finance, but they were added now. And it totally makes sense because this is more Fund 46 now that we have it at our disposal, we can take advantage of.
It gives us a flexibility for a building to say, this would be the best way to use our resources, right? Rather than say, well, this would be the best way, but I can't get it in by June 30th. So let me find another way to use the resources that aren't as beneficial for students.
Any additional questions? With the increased transfer to $512,000, what is the fund balance ratio to the 2020-2021 Fund 10 expenditures, and is it still above the 15% threshold per board policy?
Yes, it would be well above the 15%. I believe we talked about the potential of, at that June board meeting, that we were looking at, even without this additional transfer, of having over $5 million in fund balance, over 21% fund balance ratio. So even with this additional transfer, we'd be well above that 15% required fund balance ratio.
Okay. Any further discussion? Then I would entertain first a motion to approve the 20-year capital maintenance plan as presented.
So moved.
Second.
Any further discussion on the capital maintenance plan? Hearing none, all those in favor of the motion, aye. Aye. Opposed, and it passes. And then secondarily, a motion to approve the Fund 46 transfer of $512,363 as presented.
Second.
Any further discussion regarding that motion? Hearing none, all those in favor of the motion, aye? Aye. Opposed, and it passes. Thank you, Topher. All right, keep going. I think this one is yours as well?
Yes, so administration is very pleased to bring forward a summary, if you will, of the referendum that was passed back in 2017, as well as work that was done in conjunction with the referendum with additional borrowing, as well as a host of other fund sources such as Fund 10, PTG groups, the GEF, as well as the Department of Justice Security Grant. So I'd like to go through those items. First of all, we take a look at that budget summary between our referendum bond proceeds as well as the additional borrowing that we borrowed within the revenue limit, thus not having an increase to the tax levy, as well as interest that was earned and some of the rebates associated with the project. We had funds available of $42,777,000. Hoffman managed the lion's share of that, and their portion, which completed about a year and a half ago when they handed the rest of the project off to us, totaled about $350,000. And we had all along planned to manage all the projects at John Long Middle School. You can see that Hoffman didn't manage any of those John Long Middle School projects. We also then handled some projects at the other schools as well that helped us save on some of the management fees. And those projects came to a total of $1,430,000 and are outlined here on this page. Again, this was something we took a look at. The referendum summary was discussed at the Finance Committee meeting. These were the projects that were completed by the district after Hoffman handed that project off to us. So at the high school, if I want to go back and take a look at what was accomplished with the referendum, as well as with some of the additional borrowing, we expanded our tech ed spaces. This is the new autos bay that was added onto the high school. The scene shop, that's right next to the autos bays that were added. Then we have updated science labs at the high school, as well as the space we're in right now, which is the library having been updated. I wish I had had a picture of the old green library that some of you may miss, but this was updated to match a little bit more with what we kind of expect here at Grafton High School now. So we've got an updated Grafton LMC. We also have these collaboration spaces, which are right here. We have this the large middle collaboration space, as well as two collaboration spaces on either side of it as well, where kids can get together, especially next year, and collaborate on projects. Then we had the Hawk's Nest, and so certainly we want to recognize that the GEF helped contribute $16,000 toward the Hawk's Nest. And so this is where it stands right now. As a reminder, the top right picture, that is how it looked before the referendum. So much better space here at the high school. Also, right next door to the Hawk's Nest, we do have the concession stand that was updated as well. We also have the fitness center at the high school that was updated. And then as a result of GES being taken down, we had to move the production kitchen, gymnasium, as well as the maintenance building over to the high school. So the production kitchen was added at the high school, but that pushed out into the serving area. So this is the serving area, and here you can see it behind glass. There used to be seating where you have the serving area. So because of that, we had to add, off in the distance, additional commons area for student seating. This is a closer look at that, as well as a look back from the new commons into the existing commons, which was also remodeled. We also added the gymnasium, which replaced the GES gymnasium, which was often used by the high school, as well as a maintenance building, which had been part of GES. At the elementary schools, We built new classrooms as we moved from. We also added on gymnasiums at each of the elementaries. New windows were installed at Woodview, and new playground areas and new equipment were added at Kennedy and Woodview. And again, I'd point out the PTG groups helped and donated money to help enhance those playground areas. At John Long Middle School, we had the HVAC system, domestic water, and windows. Here's a great picture of the mechanicals at John Long Middle School, as well as the new windows on the right, replacing the old windows on the left. District-wide, we upgraded to energy efficiency lighting throughout. That was heavily made possible by the additional borrowing that the district took out. We also engaged in safety and security upgrades. Part of that was the referendum, but we also were able to couple that with the Department of Justice grant, as well as our Fund 10 money to enhance those security upgrades. And we upgraded areas to bring existing spaces up on par with the new construction spaces. So here, going back to the whole safety piece, the new parking lots at the high school, you can obviously see the additional green space. We have a new traffic pattern with those new parking lots just south of the football field and a new entrance into the building for high schoolers. We also have the traffic control gates that limit access to the back of the building because it is a fire lane. We also have, and these are brand new as of last weekend, these are the signs that are along 60, signs that help people navigate around the high school campus. We'll point out that some of these signs still need to be installed, and we expect over the next week those will be installed and in place. Then at both John Long and at Woodview, we had new traffic patterns with the idea of separating bus drop-off and pickup from parent drop-off and pickup. So at John Long Middle School in the morning, parents will drop off on that road in between the schools. Buses drop off in front of John Long Middle School. At Woodview, parents also will come in from the opposite direction, will come in and drop off in front of Woodview on that road. Buses will come up and do their drop off as well as pick off to the pick up to the west of the gymnasium. Same with Kennedy. We separated parent drop off and pickup as well as the bus traffic. Parents come up on the road to the south, or on the bottom of this picture, and then the buses pick up and drop off in front of Kennedy. And we also created some spaces, the vestibules at each of the buildings. John Long Middle School had a vestibule existing. Grafton High School, we had a vestibule, but we didn't have an ability to monitor that vestibule for secure entry. So we created a welcome desk there that allows people to come and let the person know why they're there. Also to pass items that they are just dropping off and they don't even need to come into the building. We created vestibules at Kennedy here as well as at Woodview. Again, so people could come in the vestibule, check in with the office without actually entering the building, helping making it more secure. Then we looked at upgrading existing spaces. So we finished the referendum and we had certainly new construction spaces that looked great, but we still had existing spaces that didn't look like our new construction spaces. So we moved toward updating spaces. These are existing spaces that have been updated with new carpeting, ceiling, tiles, paint jobs, so that everyone feels like they have a classroom that looks new and fresh and looks like similar to new construction spaces. Here are the old hallways, John Long Middle School on the left, Grafton High School top right, Kennedy bottom right, and this is how those hallways look now at this point. And we replaced ceiling tiles throughout the district. We had new casework in the new construction spaces at the elementary. The old classrooms had that old casework, top right. We went in and replaced the old casework with casework that matched new construction casework. We also replaced our drinking fountains with hydration stations. Woodview did not get a new library like Kennedy, so we did go in and update the Woodview Library. There's the old carpeting on the left, new carpeting on the right. Same with here. This is the old carpeting at Woodview on the left, new carpeting on the right. Kennedy had some walls that were as part of their gymnasium. Now they have a new gymnasium. Of course, this is the cafeteria. The old walls were not in great shape, so we updated it, and so now that space the kids are in for lunch look much, much better. So that is a summary. I'll point out, Jamie isn't here tonight. I wish he could be, because he spent a ton of time and work, effort to make so much of this happen. So a big shout out, thanks to Jamie on all of this. So wanted to bring this to you. Now that we've kind of reached this point, we obviously continue to work at making our spaces better, but everything that is involved with the referendum has come to a close, especially once we get those signs installed later this week. Any questions on that?
No questions. Well, on behalf of the board, I want to thank administration and all of the teams that were involved in bringing about the extraordinary results that were embodied and envisioned in the referendum. And I think if the 20 or so slides that you presented tonight may not do justice to exactly what was done here. And we would welcome anyone to come out and take a look. And I know that we've offered tours, but certainly we would encourage the community to come and take a look at just exactly how far their resources went. And we very much appreciate staff and the work that they did in getting us to this point. Topher, the extra effort that goes in the administration of these things. Students, parents for putting up with the construction for multi-years, right? I mean, those were alluded to at the graduation speeches earlier this year. But all the things that were reflected have been achieved. And then some, as your summary provides, and we really do appreciate the effort that went into getting us to this point, so thank you all.
And Jamie isn't feeling well. He fortunately was remotely able to make sure the air conditioning was on for us tonight. I did ask him that, but we do miss him being here. But I will say that whenever we either have the new Athletic Hall of Fame or even the Hall of Fame that's been happening for a number of years at the high school, that's one of the highlights is giving those people a tour of the facility when they haven't been here for a long time. And it's a walk down memory lane for them,
right.
And in a positive way to see the changes that have occurred at the high school. And even I mentioned Governor Evers making a comment about Woodview and the changes that have occurred over there, which is really positive.
So thank you. And yes, I was remiss in not mentioning Jamie as well. I mean, yeoman's work through the entirety of the project, so thank you. Facilities update.
Yes, finally, normally Jamie would come up and do this, so I'll fill in for Jamie. Just an update on some of the projects we have occurring here in the district. So this is the phase one of enhancing our future here at the high school with the plaza on the right. It's a bird's eye view, and the gated entry area on the left. This is from ground level. This is from just this past weekend. You can see the ticket booth as well as the columns, including the columns here in the middle that will have the Kellner Field sign that goes straight into the Hawk's Head on the concession stand. And then here's a ground level shot. You can get an idea of just how big that plaza area is going to be. Then at the John Long Middle School Woodview campus, you have the JV baseball field going in. And so that's well underway. And here's a shot of those poles that will have the netting, the backstop installed, as well as you can see the retaining wall that's being installed back there as well. Here's another shot that shows that they have the poles in for the fencing, and you can kind of see a little bit to the left of the foul pole and in the distance. You can see the fencing's already there. So before too long, they'll start installing the fencing as well. So both of these projects are coming along quite nicely.
Any questions? The north half of the ticket booth, what is planned for inside the north half?
That was something that we saw at a other high school that we went to
Okay.
for a playoff game where you can host a school store out of there. So as you think of being able, instead before we would have a table that's in the dark and people would have a hard time seeing it and maybe not everyone sees it. So directly behind that, it was very affordable. It's just a blank area
Yeah.
with power in there.
Yeah.
There'll be a light there that you'll be able to store. So as we have our school store now,
Yeah.
the students would be able to sell clothing, apparel, whatever it may be, memorabilia,
Excellent.
out of that back area for all of our events.
Yeah, good.
In a very efficient manner, because it's just a little bit more brick.
Yeah, I happened to wander into the building.
Yeah, it's just gonna be a sliding door. It's gonna be very basic. It will be very basic, but it will really give a good ability to store some things and move it out instead of having to bring everything from the high school down
Yeah,
there.
good.
And then bring it back at the end of the night. There's some security pieces that go with that.
Good, thank you, Topher. Any additional questions? All right, then enhancing our future donations.
Yes, we'd ask the board to accept these 3 donations that have been brought forward. We had sent a postcard to all of the residents of Grafton. So everyone, whether Grafton, town of Cedarburg, all those different pieces that received, that are in our area, received a donation or a postcard that would go with it. We have our focus going out to the community that will outline the different stages that are going on, but these 3 donations have come in from that postcard opportunity. So as people are looking at the ability to have their name on the donor recognition area that's in phase 1, we have these 3 donations being brought forward from John and Kate Logan at the Blackhawk level of $1,000, Timothy Tampson at the Blackhawk level for $1,000, and Ken Wagner at the Blackhawk level for $1,000.
All right, then I'd entertain a motion to accept those donations as presented. Any discussion? All those in favor of the motion, aye. Aye. Opposed? And it passes with our many thanks. Item O, Athletic Training Services Agreement.
Yes, I've asked Mr. Moore, who works most closely with our training staff, to share the importance of the contract.
As you may or may not know, for a significant amount of time, Aurora has been our certified athletic trainer provider. Since I've been on, we've been incredibly happy. Can I adjust this? Just take the mic out. Should have taken a cue from Mr. McMahon there. We've been incredibly happy and satisfied with the services they have provided. Mr. Brian Wood, who some of you may or may not know, has been with us for, I want to say, going on 15, 16 years through Aurora. He's a really well-respected member of our staff and is excellent with our kids. And our coaches and our community at large. We've worked together on a lot of things. So our 5-year agreement, previous 5-year agreement with Aurora is coming to an end. They have presented us with a new 3-year agreement that is significant, or extremely consistent with the agreement that we've had in the past. So what we're asking is for permission to go ahead and to re-sign with Aurora for our athletic training services for the next 3 years.
Is there a motion to accept the Athletic Training Services Agreement as presented?
Second.
Is there any discussion? I'm assuming, Mr. Moore, you would be the liaison?
I'm assuming so as well, since
Okay.
Mr. Deering has signed the previous agreement.
Okay. And in 3.17, we grant Aurora to operate performance enhancement programs at the school based upon the needs of the community. I'm assuming we get to approve those programs, right?
And that's consistent with the previous agreement as well.
Okay, all right. All right. All those in favor of the motion, aye? Aye. Opposed? And it passes. Thank you.
Thank you.
And we'll move on to item 5, adjournment. The Board of Education will convene in closed session to consider 1, teacher compensation, and 2, performance-related data of the superintendent and other administrators. This is in accordance with Wisconsin State Statutes 19.851C. Do I have a motion to move into closed?
Second.
We'll take a voice vote. Sean, how do you vote?
Yes.
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 And yes, we are in closed.